Good morning, all. We are here for the ninth edition of International Conference on Victim Assistance, and we are grateful towards the Center for Victimology and Psychological Study, which is dedicated towards victimology and victim assistance. Today, we are gathered here in order to speak over the central theme of victim assistance, challenges, and resilience during COVID-19. We have our eminent speakers who have joined from number of countries. We have participants who have joined from 25 countries and over 900 participants. And today we'll start our session with Professor Dr. Sanjeev P. Sahni, who is a principal director of Jindal Institute of Behavioral Sciences, who is also member of the governing body of JGU and also advisor to Vice Chancellor. I now would request Professor Dr. Sanjeev P. Sahni to give the welcome address.
Good morning, everyone.
I think, Dr. Sahni, we are not able to hear you.
Somebody should tell him about the situation.
Sorry for the delay, everyone.
I'm
Dr.
calling
Sahni,
him.
you're on mute. Dr. Sahni, you're on mute.
So 10 years back when we started, this was through the inspiration of one person, the father of victimology in India, Professor.
Dr. Sahni, you need to, we didn't hear you at all since the beginning. Can you re-begin the whole thing?
Sure. Am I audible?
Yeah.
Okay. Good morning, everyone. To certain people, good afternoon and good evening, because I know you are all from the different time zones. And we are so happy to let you know that we have the delegates from 25 countries and over 900 people have registered so far. So I want to take you to the history of Center of Victimology and Psychological Studies. So, 10 years back, we started this center under the guidance and the inspiration which we got it from the father of victimology, Professor K. Chockalingam, and we added the word in victimology, the psychological studies. The reason being, because whatever we read little bit about victimology, most of the things were talking about legal issues, economical issues, and other domestic issues. But there was very little part where it was connected with the mental health of the victim. So we thought it is important that we must do something to take care of the mental health aspect of the victims as well. So, Professor Chockalingam again helped us, giving us a draft, which probably Indian Society of Victimology drafted to be as an act if for the purpose of the passing as a bill in the parliament. So taking a clue from that, we took most of the things from that from the International Society of Victimology, which was drafted by Professor Chockalingam, and then we added the psychological component that to be provided to the victims. So we published the book on the victim assistance bill, and that book we sent it to probably all the member parliaments, governors, and chief ministers. And the best part is that from President of India down the line, people replied to our query, and they said, this is a burning topic and we need to discuss on this, and we need to have a proper act on victim assistance. Although we didn't have the Victim Assistance Act so far, but we are working hard on that. So the second thing is the support of the World Society of Victimology right from the beginning to this center. So they have involved us to participate in the United Nations. They have involved us in drafting various charters and other things. Whatever the help they have asked, the Center for Victimology has provided that. Today, we are conducting a lot of research on victimology related to psychological field, and I want to let you know that the top victimologists of the world are fully involved as well, participating, and they are also co-supervisors to the students, PhD students, those who have enrolled in Jindal Institute of Behavioral Sciences. Now, today is the 9th conference, and this year also we thought it is important that we must conduct, maybe virtual, and generally we have many people generally come and attend physically. This is our history of the last 8 years. I requested Professor Emilio Viano to deliver a keynote address, and I want to tell you, he being the president of International Society of Criminology, he gave us an opportunity to organize the World Congress on Criminology 4 or 5 years back, and there was 1,000 delegates and almost 300 to 400 delegates from abroad as well. Now, the last thing which I want to thank my own Vice Chancellor, Professor C. Rajkumar, because he has given us a complete freedom and autonomy in terms of operating and conducting a research in victimology. Although we have started teaching victimology to most of the law school students, and I must tell you, it's a hit subject. So on the behalf of the Center of Victimology and Psychological Studies, I'm very happy that at least we could offer, and we are offering many courses related to psychology and law. So I want to tell you, there are over 18 courses related to psychology and law. Probably this is the only university in the world who are offering so many courses related to psychology and law. So thank you very much, Professor Rajkumar, for that. And I want to congratulate Manjushri Palit, who virtually manages this Center for Victimology and Psychological Studies. And on behalf of Center for Victimology and Psychological Studies and Jindal Institute of Behavioral Sciences and OP Jindal Global University, I welcome all of you for this 2-day international conference. And I'm very happy that there are over 38 to 40 people who are speaking from probably over 17 countries. And now I'm getting many calls that they are not able to register, because I think we have exceeded the limit of 1,000 people. And many people are saying that whenever we are trying to get in, so it says the house is full. So we will request them that they can watch us through YouTube, but even I'm very happy to let you know that over 1,000 people have registered for this conference. So thank you all, and welcome again to the 9th International Seminar on Victim Assistance. Thank you.
Thank you very much, Professor Sahni, over your inaugural address and welcome address. Now I would request our Honorable Vice Chancellor and Founding Vice Chancellor, Professor Dr. C. Rajkumar, to give address by the Vice Chancellor to our audience.
Very good morning and good evening and good afternoon to all of you. I would like to extend a warm welcome to all of you, the speakers and the participants to this international conference on victim assistance, challenges and resilience during COVID-19. I would also like to, at the outset, thank my colleague and indeed the founding director of the Jindal Institute of Behavioral Sciences, whose visionary leadership has culminated in the evolution of the Jindal Institute of Behavioral Sciences, but also more importantly, the Center for Victimology and Psychological Studies at JGU. I also want to thank Dr. Manjushri Palit and Vipin Vijay Nair and other colleagues at JIPS who have actually maintained this tradition, this important, well-evolved tradition of having this annual conference. Of course, regardless of the fact that we are not able to physically meet, the fact that we are able to host this conference in a virtual mode actually has some unique advantages. It also can reach out to people who may not have been able to travel and who simply are in a position to be in different parts of the world and participate in the conference itself. I also want to extend a warm welcome to all others who are speaking in the conference, including in the inaugural itself, Professor Dr. Emilio Viano, Professor Chokalingam, and many others. I'm so delighted to see Dr. Irwin Waller there. I grew up hearing Dr. Irwin Waller's contribution and his own, significant impact in the world of criminology and victimology. And it's wonderful to see him and many others who are joining this. I will keep my remarks short. First, I want to say that we are organizing this conference at an extraordinary moment when less than 24 hours ago, O.P. Jindal Global University was conferred with the status of an institution of eminence by the government of India. This status is an exalted status in the Indian context. Out of the 1,000 plus Indian universities, the Honorable Prime Minister of India envisaged this policy where they identified 10 public and 10 private universities in the country through a 3-year-long process, which ultimately culminated in giving the status of the institution of eminence. We are clearly the only non-STEM and non-medicine university that has been given the status of the institution of eminence. These 10 plus 10 public and private has the leading IITs of India. It has the University of Delhi, which is obviously an old and reputed university, and a few of the leading private universities. And we are very, very fortunate that this has happened yesterday, and it augurs very well for the hosting of this conference today. The second thing I want to quickly share is that the issue of victim assistance remains one of the most critical and important issues that has confronted law, public policy, as Dr. Sani mentioned, psychology, criminology, and the whole range of issues surrounding behavioral sciences. In fact, from the standpoint of the evolution of the very discipline of victimology, we have come a long way in recognizing the role of the victim in the earlier avatar of its evolution, where the role of the victim was confined largely to the criminal justice system. Now, when you look at the evolution of victimology as a discipline and victim assistance as a framework for developing public policy, it actually includes a range of issues in which the victim needs to have a stronger presence in our thinking, in our policy. In fact, the first set of that evolution happened in the context of the earlier challenges that we faced, the world has faced, which is in relation to disaster management and issues relating to developing disaster response and rehabilitation for victims of disaster. And the current pandemic, if at all, if there's anything that we have learned from the COVID-19 pandemic, is to recognize the important role of victims. And one of the things that Indian courts have historically, recognized is that one could actually be a victim even if we are not able to, recognize who is the offender. That was, of course, recognized in the context of the criminal justice system. But there are, in today's context, if you look at state failure or state capacity or even state vulnerability, you will find a lot of areas, including the public health crisis that we're facing, in which victims need to have a stronger voice. So I want to congratulate the Jindal Institute of Behavioral Sciences, but also the many partner organizations that have come together. I note that the Indian Society of Victimology, Karunya, and of course, through the presence of Emilio, the international organizations and others have come together in organizing this conference. I can only hope that the deliberations in the conference, including the various papers and thematic sessions that are being presented, and also the keynote addresses that will be delivered, will inform and help us develop a greater understanding with regard to the future. I also want to say that this year was very special for another reason from the standpoint of our own thinking that has emerged. The university has established the 10th school of the university, the Jindal School of Psychology and Counseling, again under the mentorship of the Jindal Institute of Behavioral Sciences. And I'm grateful to Dr. Sani and his colleagues at JIPS for helping the university establish and even mentor the evolution of this new school. We will be starting the first program, the BA in Psychology, beginning 2021. And I expect that given the strong history and perspectives of the study of victimology deeply embedded in the functioning of the Jindal Institute of Behavioral Sciences, I see a strong presence in the curriculum and the core structure of the study of victimology and victim assistance when we actually focus on the study of psychology within the new school. I also want to end by saying that the opportunity to bring together so many people from around the world and across India at this difficult time has only demonstrated the collective consciousness and the commitment of people who are engaged in the work relating to victimology and victim assistance. I wish the conference every success, and I can only hope that the next conference, which we will do in 2021, we can all meet physically at our campus when we can celebrate that the world has overcome with resilience the COVID-19 crisis and would have learned lessons from that challenge, and we would all be better situated to respond to future crises, keeping in mind the victims at the center of our thinking, our policy, our law reform, and all of that. So I also want to recognize the presence of our very good friend, Professor Abdullah Shekhar, for her contribution across India. I'm not able to see many faces here, but I do know that many individuals
There's something wrong. Hello? There's something wrong with the technical.
Professor Raj, we can't hear you.
Professor Raj? Oh, I think he ended his talk.
Yes.
So thank you, Professor Raj.
Yeah. Thank you very much, Professor Rajkumar, for your address. Now I will begin with the special address of Professor Dr. K. Chokkalingam. And I'm very proud to state that Professor Chokkalingam is the founding father of victimology in India. He's currently the chairperson of Rajiv Gandhi National Institute of Youth Development, Ministry of Youth Affairs, Government of India. He has been chair professor in criminal law at the National Law University, Delhi. He has been professor of criminology and victimology at the Tokiwa International Victimology Institute of Tokiwa University in Japan. He has served as Vice Chancellor of Manomaniam Sundarnath University, Tamil Nadu. He also has served as Deputy Director of Tokiwa International Victimology Institute for 2 years. And he has the privilege to be associated with World Society of Victimology and also international organization which has been associated with criminology and victimology. And it is our privilege to have Professor Chokkalingam, even due to his limited time that he has devoted that he would be speaking for a few minutes to the esteemed audience and deliver a special address for 9th International Conference on Victim Assistance. Over to you, Professor Chokkalingam.
Before he starts, I want to tell you that doctors have advised him a complete voice rest, but on my persuasion, he is agreed to speak for 10 minutes. You have to unmute yourself. Professor Chokkalingam, please unmute yourself.
You have to unmute. Now we can hear you. You can speak now.
Who is going to speak now?
Okay.
Professor Chokkalingam, please go ahead.
Yeah, now it's your turn. Okay.
Okay. Very good morning to all of you, and good afternoon and good evening to several of our international friends who are taking part in this international conference. Now, distinguished Vice Chancellor of the O.P. Jindal Global University, Professor Rajkumar, the Chief Organizer of the 9th International Conference on Victim Assistance, Professor Sani, and his team members, Mr. Vivin Nair, participants who are taking part in this conference on victim assistance from different parts of India and other countries, distinguished faculty from India and abroad who are going to share their knowledge and experiences, friends, ladies and gentlemen. I'm really excited that many international experts in the field of victimology who have worked in this field for more than 3.5 decades to get the United Nations Declaration of Basic Principles of Justice for Victims of Crime and Abuse of Power coming into reality. Now, for example, Professor Irwin Waller, my very good friend for more than 3 decades, and Professor Dick from America, and Professor Dr. Michael O'Connell from Australia, and our own colleagues from India who have been doing extremely well in the field of victimology, Professor Bajpai, Professor Arvind Tiwari, Professor Beulah Shekhar. They're all going to speak on different topics, and it will be a great benefit for the participants, particularly students. I am happy to be part of this conference, and I am grateful to Professor Sani for having invited me to take part in this conference and speak a few words at the inaugural ceremony of this conference. Many of the participants of this conference on victim assistance might know that victims were denied justice and neglected for centuries, and it was a very long journey and struggled to fight for their rights at the global level. Though victimology is a new discipline taken up for scientific study and research only during the last 7 or 8 decades, victimization of human beings has been happening for centuries, either due to the misdeeds of other human beings or natural or man-made disasters. But justice for victims was elusive for centuries, and for the first time, the world has recognized the sufferings of crime victims in 1985 and brought out an international instrument by consensus of the world countries and adopted by the United Nations General Assembly in November 1985, and is known as the Declaration of Basic Principles of Justice for Victims of Crime and Abuse of Power. This document has been considered as a Magna Carta for victims, as it started giving some legal recognition to victims and some rights for the victims. Friends, though the UN Declaration on Victims 1985 have confined only to victims of crime and abuse of power under the criminal justice system for providing certain rights to them, the pioneer and founding father of victimology, the Romanian lawyer Benjamin Mendelssohn, expanded the discipline of victimology, designating it as general victimology. Mendelssohn included all kinds of victims under the purview of general victimology and justified the same, arguing that the type of victimization is immaterial, as any kind of suffering of victimization should be the criterion to consider and accept them as victims, regardless of the source of victimization. Through his logical argument, he proposed that penal victimology, dealing with crime victims, is only a part of the broad field of victimology, which he called as general victimology, and all kinds of victims, such as victims of natural disasters, victims of man-made disasters, victims of disease, and the consequential victims also should be part of the study of general victimology, according to Mendelssohn. The logic of Mendelssohn to include all kinds of victims under the purview of general victimology is an innovative idea and more relevant to the current times of victimization due to COVID-19 or coronavirus, and the different kinds of consequential victimization due to coronavirus has been unprecedented, as it has been a global victimization affecting all the nations and people of the world countries. The consequences of the COVID-19 victimization has impacted in the life of people in a variety of ways, including economic, life-threatening, and other health-related issues and other sociological problems. Particularly, we witnessed in India the victimization of millions of families of migrant labor, making a mass exodus of cities and states where they migrated earlier to work and livelihood, had to move to their home states for their own survival. We have all witnessed in the television channels the hapless victims with men, women, and children walking hundreds of miles back to their home states, and felt it became a national issue as the migrant labor victimization had affected millions of women, children, and old age persons, and there was no remedy offered to them even by the government in the first few days. Victimologists have greater challenges due to the advent of technology as crime victimizations using technology have grown to an unprecedented level in the recent years. Cyber victimization affecting the human in a variety of ways in the field of banking, economic transactions, sexual victimization of women and children, and spreading the same through social media are unparalleled challenges for the students of victimology and victim assistance. The International Conference on Victim Assistance, organized by the Jindal Institute of Behavioral Sciences of O.P. Jindal Global University, is focusing rightly on the theme of victim assistance, as several victimological studies have proved that what the victims primarily need after the victimization is victim support or victim assistance, whether it is crime victims or other general victims. Realizing this need of the victims only, developed countries such as US, the Netherlands, Australia, and a few other countries have focused their attention to extend their helping hand to the suffering victims by providing material and monetary support in the form of compensation and other kinds of assistance, such as psychological and psychiatric assistance. The National Organization for Victim Assistance, popularly known as NOVA of USA, and the Victim Support of England and the Netherlands are typical non-profit organizations which extend their support and help to victims. Though victimology has developed as an academic discipline significantly in the last 3 decades, not only in India, but in many other countries, through the higher education institutions such as university departments in the study and research on victims, we have to admit that in India, we have not devoted adequate attention and have not framed a comprehensive victim support program for providing practical and timely support and assistance to victims, addressing the needs of the victims. In this important task, Professor Sanjeev Sahni has a vision and a passion to extend victim assistance programs for all kinds of victims at regional level to start with, and then at national level. He has been speaking about it for a long time to me whenever I met him. I extend all my best wishes to Professor Sahni to succeed in his ideal victim assistance program. I am confident that the participants of this conference, particularly students, would immensely benefit from their exposure to the most valuable presentations of global level experts in victimology in these coming 2 days. With these words, I wish the 9th International Conference on Victim Assistance, organized by O.P. Jindal Global University under the dynamic leadership of Professor Sahni, all success. Thank you for your patient attention. Thank you.
Thank you very much, Professor Chokalingam, for your special address, and it for sure will be a blessing for each one of you, and it will motivate us to provide the best of efforts for each session that will go forward. Now, for our keynote address, I'd like to welcome Professor Emilio Vion, And I want to mention that Professor Emilio Vion is the president of International Society of Criminology, a voting member of Law, Justice and Development Forum for the World Bank, president of Belogio Forum for World Security and Social Development, and a law professor at American University. He's a pioneer in the field of victimology, victim rights, and an expert in the field of transnational crime. He is recognized internationally for his contribution to justice and human rights. He has authored countless articles and books, and recently has worked on transnational crime and is widely known for his publication in Law and Behavioral Science Journal. I want to hand it over to Professor Emilio Vion for his keynote address for this session. Over to you, Professor.
Distinguished members of the Presidium of the 9th International Conference on Victim Assistance, and especially Professor Sanjeev Sahni, thank you for the invitation to speak at this important event. It is a great honor, sincerely appreciated. Esteemed colleagues, ladies and gentlemen, the coronavirus epidemic has unleashed a global public health pandemic that has produced unique situations that affect our time-tested routines. Since the coronavirus affects almost every aspect of public and professional life, social scientists have a unique opportunity to collect real-time data on a wide range of pandemic problems. The effects on all aspects of community, individual, social, and work life, and careers of limited human contact, fear of contracting the disease, unemployment and its financial consequences, and the increase in domestic conflicts are of great interest, given the uniqueness of a worldwide situation for basically all disciplines, from political science to public health, from psychology to sociology, from constitutional law to criminal law, and more. This crisis is not only a health crisis, but also an economic one that is affecting people, companies, state institutions, and budgets. For criminology, victimology, and criminal justice, life under the virus produces a variety of complex options. For example, protecting public safety versus protecting the health of those who are under the control of the criminal justice system and those who work within it. For instance, reducing the prison population as quickly as possible to avoid massive infections and loss of life in correctional institutions collides heads-on with concerns about releasing so many prisoners at once in the community, fearing a high recidivism rate. The data indicate that some categories of crime during the pandemic have increased, while others have decreased. This is particularly true according to a theory that we all are familiar with, I think, the theory of routine activity developed by Cohen and Felson in 1979, and based on the application to criminology and victimology of the theory of rational choice in economics. The distinguishing factor in this theory is that it focuses on the characteristics of the crime rather than of the offender. Therefore, and most importantly, the environment plays a central role in the occurrence of crime. The following three elements must be present at the same time. One, a suitable and available target. Two, a motivated offender. Three, absence of an authority figure to intervene, protect the target, and prevent a crime from occurring. The environmental combination of an available and suitable target, a motivated offender, and the absence of an authority figure to protect the target and discourage the motivated offender can result in the commission of a crime. An example of an increase in crime during the pandemic are commercial burglaries and looting as a result of the closure of stores, restaurants, warehouses, and more, so that they do not have guardianship. An example of a decrease in crimes is residential burglaries due to the presence of people at home that results in great guardianship. One area that has garnered a lot of attention and generated considerable consternation is domestic violence. It has reportedly increased dramatically around the world, given the pressure of living together under a stay-at-home order without much other social life for a considerable period of time, in a context of growing concern and frustration with finances and career, pressure to supervise children, especially when school has become virtual and parents must take responsibility for home attendance and their children's schoolwork, the difficulty of entertaining young people for long periods of time in confined spaces, and the danger and at times the illegality of allowing them to go out in contact with other people with the possibility of contagion. An additional element of pressure that is interesting that has happened in recent time has been the return to the parental home of the older children who had already left. In the United States, recent data show that a record number of young adults are now living with their parents again, even surpassing the previous peak period during the Great Depression of the 1930s. This increase makes sense because young adults were hit especially hard by job losses from the pandemic and economic uncertainty. This long-term situation can generate tension, friction, discord, even violence and exploitation. Disagreements between parents and children who return home about their lifestyle, going out, socializing with their friends, and possibly bringing the infection home, and demands for financial support from young people while spending scarce parents' money on recreational activities can precipitate episodes of disagreement and domestic violence. The required social isolation can make it easier for some, especially those in a position of power, to victimize those closest to and available to them for longer periods of time. Some examples are sexual abuse of younger family members, neglect, abuse, and even murder of children with special needs and of the elderly, conflicts and disagreements with a spouse, partner, or parent one lives with, and cruel treatment of pets. The isolation of the couple or the family generates the absence of authority figures that can protect the victim, such as grandparents who cannot come visiting, in-laws, colleagues, relatives, or friends of the children, their parents and acquaintances visiting, interacting, and noticing. Teachers at the school who can detect the signs of abuse, and the public, especially neighbors, when they are away from home. The justice system will also be questioned, particularly the police, when enforcing the rules related to the pandemic, and they themselves will be affected, curiously, by the loss of income that traffic violations and other fines normally generate. Other facets of society's response to the pandemic have clearly increased the vulnerability to victimization of many people. For example, the mandatory or optional shelter in place, stay at home, command, and social distancing policies have increased people's dependence on the internet and social media to communicate, stay in touch, order food and goods, pay bills, and communicate with others, the government, and the outside world. This has led to a large increase in various white-collar crimes, such as fraud, including false cures, useless masks and protective equipment, phishing, malicious web pages, telephone impersonations of government officials, especially those related to pensions, social security, medical benefits, emergency disaster assistance programs, and also false donation appeals and other scams, as well as an accumulation of supplies and price speculation. Violent crime, especially in cities already shaken by gun violence and drugs, continues to rise, regardless of the pandemic or not. The stay-at-home order has done little to prevent violence in some large cities. These incidents mainly involve disputes between rival gang factions, for example, as well as clashes related to the sale of illegal drugs. Civil disobedience against the government rules and restriction is not uncommon. In reality, in America at least, whether or not to wear a mask to avoid infection or infecting others has quickly become a visible and even dangerous political statement. Those who wear the mask are normally identified now with the Democratic Party and Joe Biden as their presidential candidate. We are indeed, as you know, close to the presidential election next week. And those who do not use it with being Republicans and supporting the re-election of Donald Trump. So we have politicized the mask that we should use to tamp down the diffusion of the pandemic. The same is true of the norms that prescribe social distancing as an important preventive measure. This disobedience has also led to violence against staff in stores, restaurants, and other businesses that demand that customers wear a mask or keep that distance from others. There have been several incidents in the United States when people who were asked to wear a mask verbally and physically attacked the employee who made the request. Thus, the coronavirus pandemic has become an emotional variable added to political views that amplifies divisions and discord, symbolized by the acceptance or rejection of preventive measures. The theft of packages delivered to the buyer's residence and on occasions left at the front door or outside has also increased considerably. This in response to the opportunity created by the massive increase in requests for the delivery of large number of items by people who do not want to or cannot venture in public to the store, for example, in the full swing of the pandemic. They are fearful of contagion, and so they order the delivery of groceries, prepare food, drinks, cosmetics, disinfectants, medicine, and many other items for daily life. This is a classic crime scene perpetrated according to the routine activity theory. Traffic violations, at least in the US, have also been increasing, especially for speeding, due to the dramatic decrease in car traffic as a result of the stay-at-home directive. So some drivers take light or no traffic as an invitation to go faster, and so they will be nabbed for speeding. The increase in the abuse of legal and illegal drugs, especially opioids, is also related to the coronavirus pandemic and the shelter-at-home policy. This may be due to boredom, a lack of other stimuli during quarantine. Assaults on medical workers and police are also reported, usually by coughing, spitting, or sneezing on them. Hate crimes have also increased, especially against people of Asian descent, based on blaming China for allegedly failing to promptly alert the world to the coronavirus epidemic. There has also been an increase in vehicle theft, likely due to the suspension or reduction of public transportation during the general stay-at-home policy in several states and cities. Public transportation often provides the only means of getting to and from work, especially for less affluent workers. Therefore, car theft may be due to the need to reach the workplace in the absence of public means to do so. So it is quite interesting to see all this connection quickly forming in our society with different interests and different preoccupation. Unemployment claims continue to grow in the United States, and according to a report published by researchers from King's College London and the Australian National University, the economic impact of the coronavirus around the world could force 580 million people, 8% of the world population, to return to poverty, where poverty could increase for the first time since the 1990s. People living in the developing world, where social safety nets may be scarcer or non-existent, would be particularly affected. The global pandemic could undo decades of work and progress towards eliminating poverty. In effect, from access to healthcare to education, malnutrition, and maternal mortality could be devastating. Getting enough food has become a major concern, especially in urban areas, where the majority of the world's population now lives, and where it is not possible or so easy to grow one's own food. For example, in New York City alone, presently 1.5 million people depend on food provided by various charities to nourish themselves and their families. Let us not forget that each person among the millions affected by the economic recession, even in developed countries, is a human being with lives, dreams, hopes, and loved ones to support. The impact, in large part due to the distortions and injustices generated by the excessive capitalist system, is enormous, also affecting developed countries. It is much more than a financial crisis, what is happening at Wall Street, for example. Much more than that. There will be countless facets of victimization generated by this. Therefore, as criminologists and victimologists, we have to question why, for example, GDP and the stock market are such major indicators of a country's economic success, rather than striving for an economy based on equitable distribution of wealth, the provision of food and services, healthcare, access to education and training, including the university, access to the internet, home purchase support, and more. Victimization resulting from social and economic injustice and exploitation impacting the most vulnerable is truly widespread and enormous and deserves our attention. The coronavirus also evokes in severe terms entrenched and centuries-old victimizations. For example, the majority of people who died for coronavirus are reported to be older, and many had pre-existing health problems. Here we should consider the issue of unfair access to medical care, healthcare rationing, the dismissal of the elderly given their age and their perceived burden on society. Furthermore, and more importantly, there has been in many countries, including the US, a pronounced difference in the number of people of color or indigenous people who have been affected. A recent study by the US Center for Disease Control shows that long-standing health and social inequities have resulted in an increased risk of coronavirus infection, serious illness, and death among communities of color. The disproportionate incidence of COVID-19 among Afro-descendants and Latino populations in the US is well documented. Data collected in May 2020 by external researchers from more than 5,500 municipalities in Brazil shows that 55% of Afro-Brazilian patients hospitalized with severe COVID-19 died, compared to 34% of white COVID-19 patients. Structural racism in the form of high-risk work situations, unequal access to health services, and worse housing conditions are a major factor shaping the COVID-19 pandemic in Brazil. African Brazilians experience higher rates of chronic diseases, as in other parts of the world as well, including the United States, such as diabetes, high blood pressure, respiratory and kidney problems due to food insecurity, inadequate access to medical care, inaccessible medicines, and often not so healthy food and not so clean water. The same is true of African Americans in the United States and similar ethnic groups in other countries. The quality of medical care one receives when one gets sick plays a major role in who survives and who dies. The poor and minorities, often without health insurance, end up in public hospitals, where there are often considerable deficiencies in the care provided. The wealthiest and dominant groups go to private hospitals, where the care provided is typically of superior quality. In Mexico, for example, the mortality rate of COVID-19 patients in public hospital is 3 times higher than in private hospitals. On the other hand, only 15% of COVID-19 patients treated in private hospitals in Mexico die. Approximately half of corona patients in poorly equipped public facilities do not survive. Racism in itself also has a great physical impact on people of African descent or other descents, depending on the country. Studies in the United States show that daily experience of racism and discrimination can lead to dangerously high stress hormones and lower the body's ability to fight disease, including the coronavirus. The racial bias of medical professionals compounds the poor outcomes for patients belonging to certain racial, social, and in your case, maybe case groups. I mentioned the USA, but any of you can easily apply what I'm saying here to your own country. While the emphasis here is on Afro-descendants, for example, the same underlying negative conditions apply to Native and indigenous populations in the Americas and all over the world, who often live in poverty. Latino immigrants, other minorities, and also to any persons of lower socioeconomic level. For example, for all those groups, social distancing and quarantine are very difficult, if not impossible to implement. Many people sharing a small living space without privacy is one of the sad realities of poverty, exclusion, and migration. That they get sick and in many cases die is a consequence of who they are on the social and economic scale, what is or is not available to them in their daily lives. All of the factors that I mentioned above play an important role in overall health outcomes and in the successful fight against coronavirus specifically. It is minorities, indigenous peoples, and also immigrants who face these disadvantages due to systemic neglect and racism. Another crucial area that affects the ability of minorities to defend themselves from the onslaught of the pandemic is their limited access to the internet. According to recent estimates by the US Census Bureau, only just over 50% of Native Americans, we also call them Indians, as you know, still today, that only 50% of Native Americans who reside on their reservations or other tribal lands and who own a computer have access to high-speed internet service. This underscores the deep digital divide between the native country and other areas in the United States. This is also true for other minorities, such as Afro-descendants and Latinos. This is due to a number of systemic barriers that affect supply and demand in these communities. We don't have time to go into the details. Why is this relevant to a discussion of the victimizing impact that the current coronavirus pandemic has, especially on the most vulnerable segments of society? Why? One of the main reasons is access to information about the spread of the coronavirus in society. If one doesn't have access to the internet, one is very much cut off from information. How to take the most appropriate measures to prevent infection, how to search and find free test sites, and also medical assistance and food distribution points, and to have access to telemedicine. The second main reason is that due to the coronavirus pandemic, broadband access is now considered an integral part of our daily lives, business activities, and community development. The virus has forced us to go virtual, individually and as a society, in areas where such use was not yet considered necessary, feasible, useful, or positive. For example, in our universities that mostly teach now virtually these days, and no one ever thought that so quickly we would switch to this form of teaching. As a result of the pandemic, online, we bank, we buy food, we spend time with loved ones, we go to school, we attend conferences like this one and other meetings, work at home, not at the office, visit our doctor, and many other professionals through the internet without leaving our home, and in some other countries, even voting online. The internet, because of the pandemic in particular, has truly become an essential service, a public good. The pandemic has clearly revealed the inequality, the discrimination, the exclusion that makes the lives of many people, especially the most vulnerable, more precarious, difficult, costly, and dangerous. Gender issues are illustrated by the high number of women who die from the disease in many countries. For example, in Mexico, men are more affected than women by the coronavirus, and also the lower classes with respect to the richest classes. However, the group that has died the most in this battle in Mexico, for example, is that of housewives, with the majority of the dead compared to the men. It is basically 3 women to each man. The reason is that in a country like Mexico and possibly other countries in the world, housewives are the providers for the family's daily needs, those who provide what is necessary for the care of children, the elderly, the family, and feed them. To do this, very often they must leave home, take public transportation, visit markets, which are one of the main sources of contagion. In addition, they are the ones who care for the sick and are often infected by them, largely due to the lack of protective equipment and disinfectants, given their cost and the impossibility of accessing and obtaining them. So the role of women in society makes them more vulnerable to coronavirus infection and eventually possibly to death. Another factor that has a great impact on how one can or cannot avoid infection is the type of employment that one has and how their work is classified. The pandemic has forced a drastic change in the way we live, work, study, recreate, and travel. The worst part and the consequent negative results often fall on minorities, immigrants, and fellow citizens from the lower socioeconomic level. One main reason is that they are classified as essential workers, that is, people who must be physically reporting to work. As a result, they cannot avoid contacts that will lead to infection, illness, and in some cases, death. This is another manifestation, if you want, of the deep divisions of privilege and status in our societies among workers. Most white-collar workers, journalists, us, university professors, lawyers, doctors, government employees, bankers, can, during the pandemic, work virtually from home and continue to receive their wages or their benefits without interruption. This is not the case at all with the lower paid employees. Sometimes they are indeed faced with a very difficult decision, going to work as required with a high probability of contracting the disease and passing it on to loved ones at home, or staying home, but then losing their job and not being able to meet the diverse needs of the family, including labor, include food and shelter. Those incarcerated, let's not forget them, in correctional facilities also face a higher risk of infection and even death due to the enclosed spaces and dramatically higher rates of underlying health conditions. However, guidance on how to manage incarcerated population in a pandemic is limited. Effective quarantine and social distancing procedure can be difficult, if not impossible, in prisons that are at or above capacity. Minimum security facilities often consist of open housing units, making social distances among inmates very difficult. This means that in many correctional institutions, social distances is achieved by locking inmates in their cells most of the time and not allowing any interaction between inmates and recreational activities for weeks and even months. This can seriously affect their physical, psychological, and emotional health, especially given the uncertainty surrounding the pandemic. This negative situation is aggravated because visits are not allowed for months. This can deprive inmates of emotional support, maintaining family ties, and of many items necessary to survive in prison, from clean clothing to basic hygiene items, food, and in some cases, even clean water. Furthermore, it can make it very difficult or even impossible for detainees, especially those awaiting trial, to meet with their lawyer and plan their defense. Some officials have started releasing detainees pending trial, but only a handful of state prison systems, at least in the US, have released convicted prisoners. Finally, victim services. The stress of the pandemic can cause or exacerbate existing symptoms of post-traumatic stress disorder that already result from sexual assault, community violence, and other victimizations. Additionally, people with a history of childhood trauma, for example, may be at increased risk of developing a post-traumatic stress disorder symptoms when experiences a new traumatic event. Research indicates that people who have experienced more traumatic events are more likely to have PTSD symptoms. Therefore, the pandemic may result in the need for additional mental health and or victim services. Victims seeking services face unique barriers during the pandemic. Many programs have been forced to discontinue operations due to staff members becoming ill and instead interacting with victims by seeking a protection order over the phone or online rather than in person. Domestic violence cases are then reviewed by off-site prosecutors. Some courts in the United States have issued amended administrative orders, allowing emergency orders of protection, emergency motions, and extension of plenary orders of protection to be filed by email, to continue accepting orders of protection without signature, to accept testimonies of the petitioners by video conference, and describing other changes in court procedures and operation. In such a situation, an effective approach that communicates these changes is greatly needed to help ensure the continued safety and sense of safety of the victim. Keep in mind again that not everyone has access to an iPhone or to the internet. These people have been effectively excluded from intervention and assistance for months. Survivors may also face greater difficulties accessing emergency shelters during the pandemic. Also, they may decide to stay home instead of going to a shelter in order to avoid getting contaminated because it's hard to observe distance requirements between individuals in shelters. Victim service agencies are adapting service delivery methods to ensure the safety and well-being of their staff, but also the rapid and effective communication with survivors. For example, through the use of instant messaging, video chats, email, and other technologies to help victims remotely. Conclusion. The coronavirus pandemic has forced all of us around the world, absolutely, to adopt profound changes in our way of life, work, relationship, and functioning. Many of these changes have shown that the traditional way of studying, working, relating to one another, buying what we need to eat and function, completing our tasks and doing our jobs, teaching our children and instructing our university students, practice medicine, hold hearings, and even trials in court, voting in parliament, in Congress here in the US, and debating issues can be done and done pretty well in a different way that revolutionizes previous habits and approaches that were believed to be tried and true forever. It has also forced us to reevaluate and better understand how fragile our lives are, our vulnerabilities, our potential for victimization, and how deeply our race, gender, socioeconomic conditions impact our dealings with many facets of our lives, relationships with authorities, access to a healthy and productive life, advance or not in our career, and that we obtain a certain recognition, dignity, and fair treatment in society, a measure of justice, and access to health care. It has also uncovered the deep-seated racism, discrimination, exclusion, and denial of basic human rights that still dominate many sectors of society and negatively and unfairly impact thousands of fellow citizens simply because of superficial differences, such as the color of their skin, immigrant status, or gender, that make it easy to identify them as inferior, unworthy, and disposable. The pandemic has also opened up rich research possibilities to better understand and address the deepest roots of injustice and discrimination, the shortcomings of our criminal justice institutions, the negative impact of disparities in access to electronics, the internet, healthcare, healthy food, clean water, the need to address growing social isolation, ironically fostered by our growing ability to connect now through electronics across the world, like we are doing now, and ultimately to re-examine and reaffirm our commitment to social justice, equity, fairness, and compassion. May this important event at Jindal University inspire and motivate us to take advantage of this opportunity and unite to work for a more just, equitable, and fair society in which the inherent dignity and value of human life is recognized and protected without regard to race, gender, age, status, sexual orientation, and financial status. May my presentation underline that being a victim is not reserved only to victims of violent crimes, but it applies to myriad of other situations that may or may not appear in the criminal code. I wish you great success in this noble endeavor. Thank you again for your attention and for the invitation.
Thank you very much, Professor Vianum. It was indeed a very enlightening keynote address where you focused on impact of COVID-19 and how it has created victim and victimization. Now I would like to welcome Professor Dr. Manshri Palit, Associate Professor and Associate Dean of Jindal School of Psychology and Counseling, and also Deputy Director for Center for Victimology and Psychological Studies, and to deliver the vote of thanks and also to open the further subsequent sessions for the two-day conference. Over to you, Professor Palit.
Thank you, Vipin. Good morning, afternoon, and evening to all our delegates here. And welcome to the 9th International Conference of Victim Assistance. This is our first virtual conference organized by the Center for Victimology and Psychological Studies. So this is our 9th conference, and we decided that while we were deliberating on what would be the main theme of the conference, and this year gave us the main theme for this conference, which is Victim Assistance, Challenges and Resilience During COVID-19. We did not have a better way to start this conference than have these two wonderful special guests, Professor Chokkalingam and Professor Emilio Viano, start with not only talking about how the process of victim assistance evolved over the period of years and how suddenly COVID-19 acted as a boon and as a bane as well in victim assistance and victimization as well. So we thank them for this wonderful, wonderful inaugural speech, and also to pave the way for many conversations to happen in the 2 days of this conference. So thank you to our special guest. I also want to thank our Honorable Vice Chancellor, our founding Vice Chancellor, for his constant support to CVPS and to GIPS. And also, I would like to express my deep-seated gratitude to our Principal Director and Advisor to the Vice Chancellor and the Director of CVPS. Now, if you all know Dr. Sahani, you know that he is so passionate about providing platforms where knowledge exchange can happen. And for 9 consecutive years and more, he has provided these platforms where victimologists, criminologists, practitioners, academicians, early career, middle career, and late career professionals can come together and deliberate on victim assistance. So this is thank you to such a visionary leader. I would also like to thank our delegates for their enthusiasm to participate, and this is wonderful to have people representing from 24 different countries presenting in a 2-day conference. And this is one of the first milestones where we would say that in previous years we have held so many conferences, but together today, like Professor Chokalingam mentioned, that we have all the stalwarts of victimology and criminology and psychology coming together in one virtual conference and deliberating on the phenomena also of COVID-19 influencing victimization and our best practices in the years to come. So thank you to our delegates for keeping this enthusiasm and unstinted support to CVPS and to GIPS for so many years. I would also like to thank our wonderful academic partners, the Indian Society for Victimology and KITS Karunya Institute of Technological Sciences, for providing us and supporting us in conducting this conference. Last and not the least, I would like to thank the important key people in Jindal Global University who help us and support us to deliberate and hold this academic conference during COVID-19. And they are the people who always are behind the scene. So the IT and the event team that comes together to deliberate and to help us in organizing this team. And lastly, the wonderful team of Jindal Institute of Behavioral Sciences and the organizing team of ICWA, led by Mr. Vipin Nair, who have actually compiled the entire program and even now is hosting this fabulous conference. With that, I would like to open this conference and thank you again for joining us for this 2-day wonderful journey of deliberation.
Thank you very much, Dr. Parlit, for sharing your vote of thanks and also opening this session. Now I will request all the attendees. We have also shared feedback and attendance form for the inaugural session. It will help us make the conference way better in our subsequent edition. I'll request all of you to stay online. We'll start our session 1 very soon. In next 2 to 3 minutes, we'll start our session. We're just winding up with the technical formalities. Before that, I would like to thank each of our speakers for our inaugural session. Professor Dr. Sanjeev P. Sahni, Professor Dr. K. Chokalingam, our Honorable Vice Chancellor, Professor Dr. C. Rajkumar. We'd also like to thank our keynote speaker, Professor Emilio Vian, for his time. We agree that we have invited him with the time difference and it would be difficult for him also to join. So we really, really thank you for joining in for our inaugural address. Thank you very much, everyone. We are done with our inaugural session. We'll start with session 1 soon, and we have all the speakers lined in. We'll shortly begin with the first session. Thank you very much.
Personal moments, I would like to thank Professor Emilio Viano. It's so good to see you, and you are looking good. You are looking younger. So I'm very happy to see you, my dear friend. It's so good to see you. Give my regards to Vanessa. And it's so good to see Professor G.S. Bajpai. He is basically now a mentor. So the torch which was given to us by Professor Chokalingam is now being carried by Professor Bajpai. He's always there for our university, for Jindal Institute of Behavioral Sciences, and for Center for Victimology and Psychological Studies. This university owes a lot to you, sir, especially our center. And it's so good to have you. and we are ready to listen. So our friend Beulah Shekhar, Beulah is, after Professor Bajpai, is now the first one to come openly and support, and we are all knowledge partners, and thank you very much. And I'm so happy that we could arrange even during this pandemic. Professor Bajpai, I want to let you know that over 900 people registered for the conference, and worldwide is online streaming on the YouTube. And thank you very much for the support, all of you. I would say my gurus like Professor Chokalingam, Professor Emilio Viano, Professor Bajpai, and so on. Thank you very much, and I'm very eager to hear and learn from all of you. Thank you. Can we start now?
Yes, sir. Thank you very much, Dr. Sani. So I would like to hand over session 1, which is on conflict intolerance and role of criminal justice system in times of COVID, to Shanky as a moderator. He will be moderating the session, which would have speakers and chaired by Professor Dr. Bajpai. Then we'll have Professor Dr. Sam Garkave, and then we'll have Mr. Michael O'Connor and Professor Debarti Haldar. Over to you, Shanky, for moderating the session. Thank you.
Thank you, Vipin, and a very good morning, good afternoon, and good evening to all the delegates who are attending the 9th International Conference on Victim Assistance. Now, before we proceed over to the first session of the conference, I would like to share the registration form in the chat box. Participants who haven't filled the registration form, they may kindly fill the registration form so as to avail the certificates at the end of the conference. At the end of the session, I would also be sharing the feedback form for the first session, which needs to be filled by all the participants. So I would now introduce you to the chair of the first session, Professor Dr. G.S. Bajpai, who holds degree in criminology and criminal justice. He holds a doctorate degree in criminology and victimology and postdoctorate degree in criminology from United Kingdom. He is currently professor and registrar at National Law University, Delhi. He is also a member secretary at Committee on Criminal Law Reforms under the Ministry of Home Affairs, Government of India. He is presently chairperson at the Center for Victimology, Center for Criminology and Victimology. He is the author of 18 books and more than 80 research publications. So the topic for his deliberation is enabling criminal justice system for forgiveness and healing. I'm handing over to you, Professor Bajpai. You may please start with your discussion. Thank you.
Thank you, Vipin. And at the outset, I have to really acknowledge the presence of so many people. Actually, my mentor, first of all, my tribute to Professor Chokalingam, my gratitude, my good morning to you, sir. I hope you are nice, fine, and keeping very well. Great to see you, sir. Always, it's a privilege to see you. So, and I'm feeling very encouraged. And secondly, again, I acknowledge the presence of Professor Emilio, a great criminologist who has inspired the generations in the field of victimology, and his seminal works have been a great encouragement to all of us. I have to actually especially, congratulate the university today, the O.P. Jindal University. It's a great day, actually. I am appearing on a day. I am finding this opportunity to personally congratulate to Professor Rajkumar and his team. This university has today acquired a wonderful achievement, terrific achievement of, being conferred the status of Institute of Eminence, the first university that has reached, especially in social science field, and as a remarkable, I can say this is something very, very stellar contribution of this university. And of course, I have to, especially acknowledge and say hello to my very dear friend, Professor Dr. Sanjeev Sahni. In all these years, I have seen Professor Sahni bringing victimology to the mainstream in this country. And he has been tirelessly doing so much to the field and so much to the active victimologist, young generation, and this platform. And whenever October comes every year, we look at Jindal. we look at the Institute of Behavioral Sciences, it has become a fixture. So October has become synonymous to Professor Sahni and this institute and this wonderful conference. And I have seen consistently the quality of this conference going up and up, and his tremendous capacity to involve the people. I really, really admire that great sense and great, effort on his part and the leadership that he gives to, it's great to see so many faces. It's a great sight, and it is all because of Professor Sahni's efforts. So many congratulations and so many gratitudes to you for this great platform that you always provide to us. And as far as I am concerned, I have unconditional support to this center and Professor Sahni, because I always know before discussing that every edition is going to be something special. And this time I can see the kind of people he is able to, involve. My friend Sam is also present, and I'm sure that we have shared some wonderful moment. He is a good friend always. I love to share a lot of things with him. And of course, my colleague at World Society, Michael, and Devrati is here. I really acknowledge the presence of all, a wonderful panel today. Friends, as I understand that I have some 15 minutes to start with my, discussion, and this session is devoted to a very unique understanding. I must say that it's very thoughtful of you, Professor Sahni, for, identification of the theme is great, because you have identified some wonderful themes. And this particular theme, conflict, intolerance, and role of criminal justice system in the times of COVID-19, is very, very unique for several reasons. So when I was contacted for this particular session, and when I looked at conflict and intolerance, I was so much moved by this particular theme, and I immediately told to Professor Sahni that I would like to speak this time on something which is very close to my heart because of certain reasons. And therefore, I decided to speak on forgiveness. Forgiveness in the criminal justice system. I am choosing a very unique subject, and there is a little story behind, because sometime early this year, I wrote a very fabulous book by Martha Minow. Martha Minow has just retired as a dean at Harvard Law School in the United States of America. And she wrote a wonderful book, When Should Law Forgive? When Should Law Forgive is such a seminal book, though she says that it is the extension of what restorative justice philosophy talks about, but she has taken this entire discussion to a different level. So I read this book 6 months ago almost, and immediately I wrote an article in the Indian Express exploring the idea of forgiveness in the criminal justice system. So today I'll be just sharing my thought on the idea of tolerance, not intolerance, idea of tolerance and forgiveness. So forgiveness as a theme, I'll be just speaking a couple of, ideas, and then I'll proceed in the session. My discussion would start, and this particular presentation, I'm inspired by a very insightful writing by Stephens Vivas. Stephens Vivas is at the Pennsylvania Law School. He has written an article in Penn Law Scholar Series, Forgiveness in Criminal Procedure. And this article I really found very good, and therefore some of the thoughts I'm sharing. My first remark would be, what do you do when faced with wrongdoing? Do you blame or do you forgive? So my presentation would be divided into three parts. In the first part, I would try to discuss the forgiveness, the idea of forgiveness. And secondly, I would discuss the idea of forgiveness in the criminal justice system, especially from the viewpoint of the offender and the victim. So my question is, how do we react to wrongdoing? So there are two common reactions to deal with the wrongdoing. One is either you blame it or you forgive it. So even when we punish through criminal justice system, it is an official blame. You are condemning the people officially. So punishment is a form of official blaming. And forgiveness is something which we have certain instances of looking at. Pardon, mercy are kind of arrangements in the criminal justice system. But friends, I wish to tell you that we are living in times where mercy and forgiveness give way to retribution. So we are seeing a kind of resurgence of retribution in society as well as in criminal justice system. This is something very important, that we should note that the criminal justice system is really becoming very, very retributive. However, retribution is not a defining value as far as criminal justice is concerned. Forgiveness can and should exist within the criminal justice system. That is the first assumption. And I say that the forgiveness in the context of the system cannot mean simply letting offenders off the hook without being held accountable for their action. So it's not a straightway forgiveness. Rather, forgiveness can be seen as a part of healing process for crime victims. So forgiveness has something to do with the healing process for crime victims. Robert Enright provides a helpful definition when he says that willingness to abandon one's right to resentment. I have a right to resent, but I am abandoning this right to resentment as well as my negative judgment and indifferent behavior toward one who unjustly injures us. That is the something as a matter of definition. So forgiveness draws from the notion that the criminal harm is primarily a violation of public norm and community sentiment, and not necessarily a harm against the individual. So this is the first assumption in the consideration of the idea of forgiveness. So current discourse on forgiveness in criminal laws requires that the victim is not coerced to forgive and offenders are not pushed to tender apologies. This is beautiful. So victim is not to be coerced and offender not to be pushed to tender apologies. Individuals may feel pressure to relinquish their own anger. And then forgiveness draws from the notion that criminal harm is primarily a violation of public norms, as I say. Now I'll come to the criminal justice system. We all note that the criminal justice system has become an assembly line where punishment factory, pain delivering mechanism, speeding of the cases, quick convictions, sacrificing the offenders and victims day in court, and lot many things. This is a typical picture of a retributive criminal justice system. And therefore, the state exacts its justice impersonally, nominally for the community, and primarily to incapacitate the dangerous offender to deter him and others. So it's a lawyer-driven system. It's an adversarial process where police and lawyers take control of the process from the moment of crime report, and the victim is at the fence. The logic of adversarial combat leads each side to take an antagonistic posture. This is the characteristics of the adversarial system, because we want the parties to clash. The victims and community members play little role. Now the involvement of victim and community in adversarial process is just negligible. And therefore, the forgiveness does not fit most of the traditional justification for punishment. Because many of you would consider, if forgiveness is predominantly observed, then what would be the consequence for the punishment? So forgiveness by victim seems to have little or no bearing on an offender's dangerousness and need for incapacitation or specific deterrence. That is the common notion. Let us see the definitional part, where I say criminal or offender inflicts both tangible and intangible harms upon a victim. So in victimology, we understand that the harms, some harms are very direct, where physical injury, monetary loss, but intangible harms, which are also known as secondary victimization, resulting from a criminal action, it really results into insult and degradation and moral injuries, and creating a moral debt that the wrongdoer owes to the victim. And this disrespect of victims' worth justifies the victim's resentment of the offender. So this is a very different dimension. And then the forgiveness involves overcoming one's resentment of an offender for having inflicted an injury. So this is in a constant position, because the victim harbors definite degree of resentment for the wrong done to himself. Forgiveness of the direct injury must ordinarily come from the victim rather than a third party, because in many cases we find third party to become more active, but victim is not really that active. So I would say the forgiveness involves an internal emotional change, but it has also expressed itself into action. So for forgiveness to be meaningful, the victim must also manifest it by canceling or remitted the moral debt. That's very beautiful. By canceling or remitted the moral debt and repairing his breached relationship with the offender. This is what the victim would expect. So forgiveness would then require surrendering of one's personal resentment, that is, not taking the offense personally. Now let us see what are the benefits of promoting forgiveness in criminal procedure or in the criminal justice system. Because we know the criminal justice system is always very cold, abstract, and impersonal. And therefore, a more personalized, concrete criminal justice system could give much greater weight to the interests and desires of offenders, victims, and community members. And therefore, now I come to the offender side, repudiating the wrong, how the offender looks at the whole idea of forgiveness. So forgiveness from the lenses of offender. So first of all, why should offenders even want expression of forgiveness? We have recently done a study with the help of Council to Secure Justice in Delhi, where we looked at the POCSO cases, the child sexual abuse cases, and we have contacted families. Many of the families were more concerned about the fact that the offenders were not at all apologetic, nor they were acknowledging the action that they have done against the children. So the families were more inclined to seek the apologies and acknowledgement from the offender at the first place, and all other things in subsequent section. So some of the benefits to the offender are very obvious. So sometimes judges and juries are likely to impose lower sentence if the victim of the crime is ready to forgive. So I have mentioned Martha. Martha has done a lot of case studies in the US where the courts have come to the conclusion, seeing that the victims and offenders are coming closer to restore the harm done to the victim. And therefore, the judges become more sensitive to the offender also in case of forgiveness. Parole and clemency boards likewise receive victims' input and may take into account other benefits extend beyond the criminal process, and a forgiving victim may serve a reference attesting that the offender deserves a job and a chance to get back on his feet. And therefore, forgiveness may counteract sometimes negative publicity, infamy associated with a crime, making it easier for offenders to reintegrate into society. And some of other benefits, another important cluster of benefit is psychic. Psychic benefits are very important. Offenders value the goodwill of their fellow human beings at times, because the offender has to go back to the society, and earning the goodwill would be a daunting task again for him, even though he has come out of the prison. So forgiveness may lighten the burden of guilt from their shoulders, making it easier for them to move on their lives. So criminal justice system could do much more to encourage defenders to pave the way for forgiveness by admitting guilt, expressing remorse, and apologizing. So defense lawyers could work with their clients and challenge their false denials by confronting them with contrary facts. Now I'm coming to the last leg of this discussion from the viewpoint of victim. Martha says for the victim, it is all about letting go of anger and grief. Forgiveness lets the anger and grief go away. So having been victimized, many victims are understandably angry, scared, sorrowful, and even grief-stricken. We naturally assume, now how we as a society understand. When I wrote an article in the Indian Express, a lot of people were after my blood. You are talking forgiveness when the four, convict in Nirbhaya case were about to be hanged. Because we naturally assume that the victims want vengeance and call for blood. Very interestingly, Stephens cited empirical evidence which suggests that the victims are far less vengeful than one might think. This is very unusual finding, that the victims are not always looking for revenge. Forgiveness benefits victims as well as offenders. So until victims forgive, they are likely to bottle up sorrow, shame, fear, incomprehension, anger, even hatred and rage. Therefore, even for the victim, it can be a good way to ventilate their anger. How should a victim's forgiveness or refusal to forgive affect punishment? Now let us understand what is the impact of forgiveness on punishment. So today, the right to punish belongs to the state and not to the victim. This is very interesting. So the entire monopoly of punishing the people rests with the state, and the victim is no partner in terms of influencing the whole trajectory of punishment. Therefore, the exclusion of any victim's right seems especially puzzling when the victim wishes to show mercy. This is very interesting. Even if the right to punish belongs to state, the state should take the victim's interest into account by giving weight to the victim's forgiveness. So first, there are certain 3-4 very interesting consequences. So first, the forgiveness provides a basis for mercy. An expression of forgiveness may remit the victim's claim for punishment, and the state should heed the claim of most interested party. Second, forgiveness helps victims to cleanse themselves of anger and vengeance and promoting emotional healing. And third, an important function of punishment is to vindicate victims. Offenders have exalted themselves at victims' expenses and violated their autonomy. So punishment even the scales, vindicating victims and their autonomy by humbling offenders. So by forgiving victims show that they are already recovering from their wounds, and so many need somewhat less vindication. So in the process, forgiveness also reaffirms the violated norm, party substituting for punishment's role in vindicating norms, and fourth, victims have a psychological need not only to express their feeling about their crimes, but also to feel that they are being heard. So the power to forgive and dispense mercy places the victim above the offender, at least partly rectifying the power imbalance and empowering the disempowered victim. That is very important implication. So furthermore, the discussion of incapacitation, deterrence, and various kinds of retribution has ignored a fourth justification of punishment. There is a fourth justification of punishment, that is moral reform. Empirical evidence of restorative justice outcomes certainly suggests that participating offenders are more likely to apologize and sympathetic enough to forgive, were already less likely to recidivate. So nevertheless, apology and forgiveness may reduce recidivism by fostering offenders' resolution to change their lives and opening doors to lawful employment. So if forgiveness furthers moral reform, there may be less need for traditional punishment. And therefore, I finally find, because when we consider forgiveness as option in the criminal justice process from the standpoint of victim, I find criminal justice grows and matures much more in the direction of, really making difference positively in the society, because we are living in a society where criminal justice system is more reactive, and as if we think that by punishing the people, you are reforming the society. In fact, the operation of criminal justice system cannot be limited to being a tool of revenge. Rather, it must promote empathy and harmony by way of humanizing the relationship between the offender, victim, and the society. The criminal justice system, as we know, is incapable of healing and does nothing to repair broken relationship. I find the perpetuation of breaking relationship continues with the operation of criminal justice system. So criminal justice system really doesn't do much consciously to repair the broken relationship, because we feel that merely reacting, because we are seeing all the states have become incarcerating nations. Over criminalization has become a trend in all the countries. We are sending more and more people behind the bar. Crime continues, criminalization continues, over criminalization also continues. So where we are heading in terms of criminal justice system? I am not saying that forgiveness is a total option. I am saying there may be certain cases where forgiveness can be one of the options, and probably it would bring a lot of positives for a just, human, and sensitive criminal justice system that would contribute to just societies, and that would be the real meaning of the justice. So thank you. This was my presentation, I really, if you have any question, we can probably later can take it up. I know this is a very distinct and rather a new subject on which today I have embarked upon, but this is something I feel very strongly about, and therefore I tried a small. We are working on this subject and probably will come out with a lot more concrete as far as this particular theme is concerned. So thank you. So with this, Shanky, should I invite, or you will invite?
I'll do the needful, sir.
Okay.
Thank you so much for delivering on forgiveness and healing in the criminal justice system from the viewpoint of both victims and offender. It's always a pleasure to hear you, the concepts, the ideas, the topics that you bring about. Now with this, I would like to invite the second speaker for the first session of the 9th International Conference on Victim Assistance, Professor Dr. Sam Garkave. He is an adjunct associate professor at School of Law and Justice, Southern Cross University, Australia. He holds Masters of Law degrees from London University and Sydney University, and has been admitted as an attorney at law in California. Sam has extensive experience in teaching courses in victimology, international law, international criminal law, human rights, and criminal law and procedure. He has published widely in a number of areas, but particularly in the field of victimology. The topic for today's deliberation of Professor Sam is the importance of victim participation during the criminal justice system for victims' well-being. Professor Sam, we received your PowerPoint earlier this morning. I'll share the PPT on your behalf. Whenever you need to change the slide, you please inform me. And I would now like to hand over it to you. Thank you.
Thank you. Can you all hear me? Yes? Okay, thank you. Thank you all for those who have made this conference possible. I'm not sure if you can hear me. Can you hear me? Yes? Yes? Right, I can hear you now. Okay. This is my first, I'm a little bit nervous because this is my first virtual presentation at a conference I've ever done. I'm not so nervous about the presentation, but I'm nervous about whether the technology is going to work. So bear with me. It's good to see some familiar faces. Professor Bajpai, it seems like every time I give a talk in India, you're always the chair of my session. I don't know how that's worked out, but it has, and I'm very happy. It's good to see some others. Dr. Sani, when I see you there with your office in the background, it really reminds me of being on the campus again. And it's wonderful to be back on the campus, even though I'm only really on the campus virtually at the moment. My time at Jindal was far too short. Well, we all know that the world went a little bit crazy at the time, and I'm just really sorry I wasn't able to complete my classes on campus. The course I actually taught was called, excuse the long name, can we move the PowerPoints? Because how do I move the PowerPoint? I'm not sure how to move the PowerPoints, because the PowerPoints really will tell everything. The course I taught was a long name called Victims in National and International Justice, Protection, Participation and Reparation. So the three pillars.
Vidyut, can you help us with the screen sharing? It says your screen sharing is paused.
Okay.
Just a minute, sir.
Yes. Okay. What else do I have to do?
Screen sharing rights has already been given to you. I think
it says your screen sharing is paused.
Maybe there must be some internet issue, because rights are there in place. Yeah, it's visible now.
It's visible now? The PowerPoints are visible, yes? I can't see that on my screen, but that's all right. Okay, I'll just continue. I'm not sure how I can see the PowerPoints and move the PowerPoints. See what I was worried about technology.
Shanky, can you upload the PowerPoint and then move through the PowerPoint, please?
Would help a little bit, but I can talk without the PowerPoint. It's not so essential, but it would make it easier. This is a world record for me. I only have 8 PowerPoints actually. Normally I have a lot more. So I really want to finish. I was told 15 minutes, it's not a lot. So 8 PowerPoints is pretty good. But okay, so the
ma'am, it says your screen sharing is paused. I am unable to share the screen.
I don't know how to, hang on. Does that help? Whiteboard. No, I can't find where the PowerPoints are. So we'll do it without the PowerPoints, and I can send them to anybody who wants them. But look, so in the victimological literature in India, there's a lot really written about the concept of victim protection, particularly in terms of sexual assault and rape victims. And there's, particularly since the Indian federal government enacted compensation laws or provisions of the criminal code in 2009, and some jurisdictions now have victim compensation. There's quite a bit of material in the Indian literature about victim compensation and other forms of reparation. But there's very little in the Indian literature about victim participation. And there are 2 primary reasons for this. One is it's a far more controversial and complex issue, as it often involves questions of fair trial, and which are not often part of the issues dealing with victim protection and victim reparation or victim compensation. But the second reason is probably more important. There is a misconception that India has very little laws about participation. this is definitely not the case, and I'll give some examples of some of the participation laws in India. And also, I will show later on when I talk about the potential of victim impact statements that it is possible for Indian victims to present victim impact statements. One doesn't need enacted laws for this to work. Now, what does victim participation involve? Because I think there's not a lot of understanding about this. Now, the traditional role of victims in common law systems meant that they were largely viewed as just a merely piece of evidence to be called to testify when and if the prosecution wants to call them. And when they did testify, their evidence was always much on a question and answer basis, and then they were obviously cross-examined. Now, I don't regard such a limited witness role as participation. That's not what I mean by participation. Participation, in my view, is where victims have some agency. They're able to present their opinions, perspectives, and or the facts as they see them at critical times in the justice system. They can make independent decisions on their involvement, and most optimally, they can have their own legal representation, both inside the courtroom, which is not allowed generally in adversarial systems, and outside the courtroom, which is generally allowed. Now, the ultimate in victim participation is when the victim is a party to proceedings, as is the case in European systems of justice and potentially the International Criminal Court system. So, what are some Indian examples of participation in the Indian criminal justice system? I think it's important to list some of them. And I want to really thank a student of mine this year, Rishabh Jian, who did his paper on Indian participation in the criminal justice system from a comparative view, looking at other jurisdictions. Some of the points I make here are directly as a result of his research, so I thank him for it. So some examples of participation in the criminal justice system. I'm just trying to get back to how I was before. Yeah, I'm having a lot of trouble, sorry, with the technology. I can't see everybody. I can see myself and I can see a few other names, but no actual live people anymore, which is what I always hated about lecturing online, and I much preferred lecturing in person. Okay, so let me list some of the examples of victim participation in the Indian criminal justice system. So in India, the cases are divided up, many of you might know this, between what's called non-recognisable cases and cognisable cases. So in non-recognisable cases, these are basically minor cases where the penalty is less than, the potential penalty is less than 3 years imprisonment. Now, in these cases, victims can actually institute their own prosecutions, which is similar to the way private prosecution works in other common law systems. And if they do that, they have all the rights that a party would have to a case. So those rights would include the ability to call witnesses, to frame the charges, and to do the work that's needed in order to prosecute a person. Now, my student, got it. Okay, I've got it now. Can we go to the next PowerPoint, please? I just can't seem to. Okay, so my student has found out that in 2017, about 18.2% of total cases that are pending in the Indian criminal justice system were actually these, what I guess is private, what we would call in my country, private prosecutions, where victims are parties to the court case. Now, in more serious cases, cognizable cases, victims, in those cases, victims have a right to a copy of the police's first information report, FIR, of the case. And if the police don't give them to the victim can institute an action in a magistrate's court to force the police to record that information and thus start an investigation. Once that case proceeds, victims then have the right, they don't even have to ask about this, to receive a copy of the charge sheet that the police have filed. If the police or prosecutor then decide to drop the case, which we call in our country a nolle prosequi, which is similar to England and America. So if the police or prosecutor decides to drop the case, the victim in India has a right to appeal this decision to a higher court. Now, could I have the next PowerPoint, please? 7. Okay, other ways in which victims can participate is that they have a right to appeal a decision to grant bail where a lower court makes a decision to grant bail to a defendant. Victims have a right to appeal that to a higher court. Now, in plea bargaining, where the defendant has given notice that they want to plea bargain the case, which they have to do in the Indian criminal justice system, the victims then must receive notice that this plea bargaining will take place, and they may be present at these negotiations. Now, the prosecutor is still free to make whatever decision they want, but the plea bargain, is actually subject to a veto by the victims. There are certain serious offences, namely offences that carry a penalty of more than 7 years, that cannot in fact be pleaded. And finally, I want to talk a little bit about sentencing. Now, there's no law yet in India, unless they've recently, or at least one jurisdiction has brought in such a law, that specifically provides for victims to submit a victim impact statement during a sentencing hearing. However, you don't really need such a law. Prosecutors have a lot of discretion in sentencing hearings, and they have the ability, if they so choose, to submit a victim impact statement as part of the evidence and arguments at the sentencing hearing. So that is potentially a huge cause for victim participation, especially in the multitude of cases where the defendant has pleaded guilty, and all you really have is the sentencing hearing. So I assume you all understand what a victim impact statement is. Gives the victim a chance to tell the court what the effect of the crime was upon them, and this can be a very emotional thing, and is quite useful in many cases. So can we go to the next slide, please? There's only 2 more to go. I don't know how to get the next slide.
So this is the 8th slide.
Yep, okay. So let's come to the main point of my talk. Why is victim participation good for the mental health of victims? Firstly, it makes victims feel they are an important part in the case. They are not like other witnesses. They have more rights than just normal witnesses. So victim participation often only allows victims to participate. It makes it far more likely, because where you have laws allowing participation, these laws often provide that victims get notice the victims do get notice of further proceedings that are going to take place. And it gives them, so it gives victims much more likely that they will receive information about the case. They can feel that the trial is fairer and that their procedural justice needs and interests are being protected, or at least listened to, as they will have an input before a decision is made. And I guess the overall reason is participation can help overcome a victim's feelings of powerlessness. There's a common feeling after a crime that a victim feels powerless. So at least giving them a role, some sort of participation in a case can help them overcome those feelings. Now, victim impact statements, for example, are a good example of the therapeutic benefits of victim impact. Now, in a lot of common law countries such as mine in Australia, victim impact statements have been able to be tendered in sentencing hearings for 20 or 30 years now. And the evidence is quite strong that they have a positive therapeutic effect. And that's especially the case when you have a family member of a homicide victim presenting a victim impact statement. And it's the case, the therapeutic effect is even there, even if the victim impact statement has actually not had an impact on the final sentence. That's not as relevant to the therapeutic benefit as one might first think. And I guess that's where my talk might relate a little bit to Bajpai's talk about forgiveness and about, because I think the involvement of victims is a sort of measure of bringing restorative justice into what has traditionally been always in our countries anyway, a very adversarial system. So they're the arguments in favour of victim participation, why it's a good idea. But I will finish off with a note of caution. Victim participation must be carefully provided. It has the potential to be counterproductive in a therapeutic sense. So in other words, it can be a double-edged sword. Victim participation obviously can add to a victim's stress, knowing that they can participate. They probably feel they've got an obligation to. It adds to their costs. It can add to their costs because they feel they have to be at the court more often. And most importantly, it can add to their expectations. It can lead to false expectations, maybe that their input will make a difference to decision making. And if their expectations are not met, this can have a negative impact on a victim's mental state. So in order to ensure that that is kept to a minimum, we need to, first of all, be careful about the role we give victims, make it practicable, make it achievable about what they can and can't do. If you can afford to give victims legal representation, as is the case, say, example, in the International Criminal Court, well, that is a better thing because it reduces the victim's stress considerably. But most importantly, one needs to explain to victims what they are going to expect by being involved in the case and the possible limitations of their input in decision making. So while victims may have a right to produce a victim impact statement, we know that there are so many factors a judge must take into account at sentencing. It's not just about the victim, it's about the convicted offender, their record, their previous convictions, all those kinds of things. The victim impact is only going to be a small part of the judge's thinking when it comes to providing a sentence. We also need to ensure that there is a choice for victims as to whether they wish to participate or not. And the rules need to make it clear that if they don't participate, there should be no adverse implication that will be made by the court or by the decision-making authority if the victim chooses not to participate. And if you look at the victim impact statement rules in most jurisdictions, they do say that the fact that the victim has not submitted a victim impact statement should not negatively impact the court's decision on sentencing. So I hope I've stuck to the 15 minutes. As I said, it's a world record for me to only have 8 PowerPoints. So I'll leave it at that, and I look forward to any questions afterwards. Thank you very much.
Thank you, Professor Sam, for sticking to the time limit and delivering on the importance of victim participation during proceedings and related to mental health of the victim. I would now like to introduce to the third speaker for the first session, Mr. Michael O'Connell. Mr. Connell holds master's degree in public policy and is a consulting victimologist. He is a victim advocate for Second Chances, member of the International Network of Services for Victims of Terrorism, and Foundation board member of Victim Support Asia. He was appointed South Australia's first Commissioner for Victims' Rights in 2006. He is presently Secretary General and Chair at UN Liaison Committee, World Society of Victimology. The topic for today's deliberation for Mr. Michael is Crime Victims' Right, a Remedy for Injustice. Now, before I hand over it to Mr. Michael, I would request him to adhere to the time limit as we are already running behind. Now, over to you, Mr. Michael. Thank you.
Ninamani, which is the greeting of the people of the Adelaide Plains where I currently sit, and I welcome you. Now, just bear with me a moment because, someone's putting my PowerPoint up for me. That's very nice of you. All right, can we go to the picture then? I was going to do it myself, but I'm more than happy to do it if you would like to. Is it possible for me to do the screen share just to make it a bit easier for me? Thank you. There we go. Very good. All right, so the subtitle of the presentation as I've written it is to point out that when we're having these sort of discussions, it can appear that we have taken a particular side. And today my argument is going to be about the victim side, and therefore I won't be canvassing issues to do with the person who is accused of the crime, except to make a couple of cursory comments. So let's begin with this famous painting. A quick look at the painting, and I imagine the first things that stand out are the person with the plough, the horse, the battleship in the background, the other ships in the harbour, the pleasant countryside with the livestock being tended by a shepherd. But if you were to look more closely, you would actually see in the bottom right-hand corner Icarus struggling against the torrent of the water about him. But you'd also see, if you look closely, a single hand reaching out as if desperately seeking the help from someone else. Yet everyone else in the painting is oblivious to what's going on. Everyone else in the painting doesn't appear to see or hear his plea for help. If we look a little bit closer, even more to the picture, and you'll see the arrow pointing in the top left-hand corner, when you blow the painting up and look more closely as it appears in its full size, you can actually see the head and part of the corpse of a person. And again, everyone else is going about their business, doing what they're doing. And there's even a picture of a bird who just appears to be looking out in towards the ocean with no interest at all about all the things that are happening about. Now, some of those people may see some of the happenings, but they truly don't observe what is going on. Why do I draw your attention to this painting? Well, it's a shorthanded way of pointing out that there are many blind spots in the criminal justice system. There are many occasions when victims reach out and seek help, but they don't find the help that they anticipate. There are many victims who have needs, immediate as well as short-term, medium-term and long-term, which are not met. And there are many people in the criminal justice system who are tasked with responding to victims' needs, to respecting victims' rights, who tend to treat victims with some sense of ambivalence and certainly lack awareness about the range of expectations and range of needs that victims have. Debate some 5 decades or so ago on this particular issue led many people to believe that one of the remedies was to promote victims' rights. And so over the last 5 decades, we've witnessed an incredible development, great momentum in advancing victims' rights and victim-centric or victim-centered justice. And that international discourse has been informed by, for example, the United Nations Declaration of Basic Principles of Justice for Victims of Crime. And in answer to one of the questions in the chat, it also covers victims of abuse of power, that is abuse of power by government institutions such as the police and other. That document's been both informative but also instrumental in encouraging other proclamations around victims' rights, such as the Regional European Framework Decision on the Standing of Victims in Criminal Proceedings and the Commonwealth Secretariat that covers all of the former countries colonised by Britain that are still members of the Commonwealth. Their statement of basic principles of justice for victims of crime. And then there have been some local domestic laws. Now, often these documents are referred to as charters or declarations on victims' rights. But what then is a right? Well, a right has a number of aspects to it. The first is that it has an entitlement. That is something that is owed to someone. So a victim is entitled, for instance, to information about the progress of an investigation. It also creates an obligation. So that obligation in the case of that information entitlement is on the police to keep the victims informed about the progress of the investigation. Some rights are written in the active and some are written in the passive. And there are some variations on what that might mean. For example, some crime victims are able to participate in decisions that are made that might affect them. That's what one might call an active right. Whereas there are some other rights that don't necessarily require the victim or to do anything in particular or empower them to do anything. A classic example of that is that every human being has the right to security of their person, and so therefore every assault that happens is a violation of a victim's passive right to the security of their body, of their person. Some rights are negative and some are positive rights. For example, the point I just made about human beings having a fundamental right to security of their person, but also in terms of positive rights, they are rights that, and I have to say sometimes they can be quite contentious, that prescribe or require some type of response, such as the positive right that the victims have as an entitlement, that where restitution is not available from the perpetrator of a violent crime, then the state should provide compensation. And rights can also be discussed in the context of status and instrumental theory. And I'm not going to have a great deal of time to elaborate on that, but I will make my speaking notes available to people. So what are victims owed? What should others do? Well, I've just summarised a few examples here, on the slide. So they are entitled, as I mentioned before, to informational rights. They're also entitled to participatory rights, such as there should be steps taken to allow their views and concerns to be presented and considered at appropriate stages in criminal proceedings. Sam Garkawi mentioned victim impact statements as an example. Professor Bajpai mentioned restorative justice, where victims can participate. They should be provided with assistance throughout the criminal justice process, and that is the obligation is on the state, as one example, to ensure that those services that meet the criteria of assistance also meet victims' needs. Should minimise inconvenience to people. And this is something I'm going to address a little later when I look at the impact of COVID-19 on victims' rights. And there are some other entitlements there and obligations that others have as a consequence of those rights. Now, I want to turn for a moment to victims' procedural rights. And one of the reasons I do this is that victims' rights to participate have tended to be the focus in the last decade or two. And we've seen, for example, in Japan, victims being given the right to be co-accusers based on the German model. In my home state in South Australia, victims can appoint an approved representative to exercise any right they may hold in the system. And an approved representative can include legal counsel. We've seen federal laws that came in the United States also provide for legal counsel in certain ways. But generally, with the exception of places like Japan, these procedural participatory rights haven't of themselves made victims genuine parties in criminal proceedings. But in some circumstances, that's the intent. Now, COVID-19, what has been its impact on crime victims' rights? And I've tried to summarise some general observations into these dot points. So it's quite clear, and this was alluded to by Professor Viano earlier, that COVID-19 restrictions have hindered access to services and support for victims of crime. Some services have been temporarily closed. Some services have been disrupted in terms of their frequency and their availability. We've seen that victims' access to other forms of healthcare, whether or not they actually have been exposed to the virus, have been hampered. So people who have pre-existing health issues, or even victims who have mental health issues that have been exacerbated as a consequence of victimization, are not able as readily to get access to some of the more generic healthcare services, let alone the specific victim support services. The risks to particular vulnerable groups have been exacerbated, and there's been a considerable volume of research done into the impact of, for example, household restrictions or quarantine containment policies and its influence on the rates of violence against women and girls in households. We've seen police resources diverted. So here in South Australia, as an example, over 500 police have been diverted to assist with responses to COVID-19. So that has meant that the time for investigations, response times to victims, etc., have all been impacted in a quite negative way, despite the best endeavours. And we've seen here that the police have turned to the public at large to look at the possibility of recruiting volunteers to assist them with some of their traditional functions that don't require specific police powers. And there's been delayed access to justice with the postponement of trials and the closing of courtrooms, the changing of the way that proceedings have been conducted. Now, all of these, and I'm sure there are many others that you as an audience can conjure or think about, all of these have required quite innovative responses. So we've seen, for example, the victim services move to online services. They don't necessarily match the needs of all victims of crime, but they do provide at least some temporary relief for some victims, and some victims have found that access to services has improved through those means. But in other parts of the world, that has not been the result. For example, here in Australia, many of the remote Indigenous people live in areas where there isn't good access to internet-based facilities. Not every household has internet or computer-based facilities to be able to utilise such things. In terms of accessing healthcare, in some circumstances, there is a need to access private health, and because of the increase in unemployment, etc., resulting from COVID-19, that's no longer affordable, and so some people have had to delay ongoing treatment in those areas. These have invited other sorts of innovative responses. For example, now court proceedings are more reliant on using audio-visual technology. What are called wet signatures or e-signatures are acceptable for some documents that are lodged with the courts. And there have been some steps that have been taken in other very practical ways in terms of regulating witnesses coming and going from criminal proceedings. So now stop sharing. So it seems to me that there's a very strong argument for victims' rights, but it also seems to me that now during COVID-19, we need to give some consideration to non-traditional, non-conventional ways about how we ensure that victims are able not only to exercise those rights, but that those who are obligated to honour them fulfil their responsibility. Thank you for the opportunity to speak this afternoon.
Thank you, Mr. Michael O'Connell, for delivering on rights of crime victims and specifically focusing on the COVID-19 times. And I would also like to thank you for being active in the chat box and answering to the questions of our attendees. Now, I would like to introduce to the final speaker of the first session, Professor Dr. Debarati Haldar. Professor Debarati is a professor of legal studies at United World School of Law, Karnavati University, India. She is also the honorary managing director of Center for Cyber Victim Counseling, an online not-for-profit organization. She is founding secretary of South Asian Society of Criminology and Victimology and the India chapter head and member of Board of Trustees of International Society of Therapeutic Jurisprudence. She has authored 5 books and edited 1 book and written many scholarly articles in the field of law and criminology. I would now request Professor Debarati to take over and deliver on her topic. And I would also request her to kindly stick to 10 minutes timeline as we are already running short of time so that we can smoothly run the upcoming sessions. Over to you, Professor Debarati. Thank you.
Thank you. I have a PPT, so if you could kindly run it.
Sure.
Okay, while the PPT is being run, thank you for giving me this opportunity. So my research here centers around the plight of the wives of convicted and charged accused of sexual offenses, and I have concentrated mainly on the case of Punita Devi, who is the wife of one of the accused, one of the convicted persons of Nirbhaya case, Akshay Kumar. So while the criminal justice machinery, I can't see the PPT, if you could kindly run it. Okay. So while the criminal justice machinery may consider awarding...
Just a minute. Vipin, I am unable to share the screen. Can you please do the needful at your end?
Yeah. Ma'am, you can continue with the address. I'll just share it in a while.
Yes. Thank you. Either way, this is for the title slide. So I'm basically introducing you to my research area and also the topic. So while the criminal justice machinery may consider awarding heavier sentences or even less heavier sentences to such offenses, some of which may have therapeutic effect when seen from the perspective of therapeutic jurisprudence aspect, and while such sentences may be aimed at reformation and future well-being of the offenders, including their families, including the economic well-being of the offenders, my argument centers around the point that wives of such sex offenders are least taken care of. So, especially by the justice delivery machinery and the victim assistance stakeholders, including free legal aid cells, NGOs, etc. Such wives may be innocent victims. They may not have known about their husband's deeds till the matters have been exposed or reported. Yes, please stay in this slide. I argue that they are primary victims of their husband's deed. They undergo deep traumatization for being cheated in their marriage. They also undergo labeling by their marital families for not being able to sexually and materially satisfy their husbands, because of which the husbands have become rapists or sexual offenders. Right from the time when the cases are exposed, when such men are arrested, or they have been suspended pending inquiry, especially for workplace sexual harassment, etc. The women may also be barred from accessing justice for their own rights, which includes legal rights, and even if they want, societal and familiar pressures basically may not allow them to reach out to the counselors, including the legal counselors, who may advise them to get separated on legal grounds, because we have seen that, especially, for example, Hindu Marriage Act, Section 13, allows for such kinds of separation when the husband has been convicted for rape or criminal offense or bestiality, etc. This basically gives rise to probable future financial crisis for such women, because as wives of convicted sex offenders, they may not get any benefit either from the private stakeholders, or even in certain cases, they might be labeled, they might be profiled in such a way that the government benefits may also not be easily accessible for them. Let me quickly show the plight of Punita Devi here, as you can get to see. No, the previous slide, please. As you can get to see in the picture, on 19th March 2020, she was seen before the Supreme Court crying, beating herself, and pleading also to everyone, including the government and also to the media, to not to hang her husband. Unfortunately, she was probably advised by the media that this thing will basically help her indirectly to gain more sympathy, but that didn't. On the contrary, when it went to the cyber media platform of the YouTube, Facebook, Twitter, or even Instagram accounts, you can basically see that how she has been vigorously trolled. She has been called as witch, she has been called as a dine, and also, it's not my words, if you can see the trolling messages which are still available. And this basically has added to the plight of this poor victim, whom I basically call as victim, because she was basically even not counseled that she could still then go to the legal aid cell. She can approach the courts for getting some rights for herself individually, not as the victim or not as the wife of a sex offender. Can we go to the next slide, please? So this is basically the time frame, the chronological time frame from when the convicted persons were basically appealing or praying for the mercy petitions, etc. Basically, this entire thing had taken 8 years' time, and we do not know that what had happened to the wives, especially in this case Punita Devi, for this past 8 years. Everything was exposed only when on 19th March the Supreme Court upheld the decision to hang the offenders, and on 20th March in the wee hours, the offenders, including Akshay Kumar, was also hanged. But why I have basically chosen this particular topic is that we all know that from this time onwards, the lockdown basically began. And at the fag end, that is on 19th March, when she was basically seen fainting on the road in front of the Supreme Court, there was nobody basically to counsel her, except a few women lawyers came up to physically comfort her. She was not taken care by any medical assistance also, as far as we understand from the reports. She was not taken to any free legal aid clinics or even to the DLSA also, whereby she would be told that even there are some time that you can immediately apply to the court. However, at the fag end, we do get to see that she was told that there is some right that she can basically be separated. However, because of the COVID situation, when she approached the Bihar court, especially in her district, it was too late. Even though it was on special grounds, it was seen that she was not allowed to get a divorce before the hanging took place. Next slide, please. Okay. Now we have to analyze this case from the cyber victimological aspects as well as from the therapeutic jurisprudential aspect. In the cyber victimological aspect, we do get to see that the profiling had been done by the media and also by the internet, web services, web sites, the companies, as she is pseudo criminal because she was supporting her husband. Nobody basically understood that she was basically fighting for her own rights. Unfortunately, when we compare this with the therapeutic jurisprudential aspect, where law is considered as a healing tool, nobody basically counseled her that she has a right to be on her own. She can be considered as the victim of the entire situation. The public was basically for Nirbhaya, and the entire criminal justice system was also looking at Nirbhaya's, justice system, the entire, well-being of Nirbhaya's family, but nobody basically took care of Punita. Next, as we get to see, she was vigorously trolled vigorously trolled. At the same time, we have also seen that hardly anybody basically took care of the victim impact and victim well-being. If we see it from the perspective of therapeutic jurisprudence, of the welfare laws that are available in our country, and obviously access to justice, which is available to all citizens irrespective of their status. Which is more concerning is that she had a child, and that child was also photographed. The child was also shown in almost every media exposed pictures, and that is still available. Nobody basically thought that this child is basically right now, when this thing was going on, has basically stepped in the status of child in need for care and protection. His confidentiality, his privacy, etc., was grossly ignored, just like his mother. And these photographs, contents, and the trolling probably are still available on the internet. Now, what happens here is that if you see again from the therapeutic jurisprudential aspect and also victimological aspect, what we get to see is that there was a delayed counseling, especially for Punita. She was advised that if you go ahead for doing these kinds of crying, etc., which is very normal for any victim, as we did get to see from Professor Bajpai and other eminent speakers. This is very normal for any victim. This was basically shown as a drama, which is also the media came up to say that this is a drama to basically stall the hanging. Next, what we do get to see is that, again, from the cyber victimological perspective, this is nothing but basically a visual victimization, which I, in my earlier research, also shown, because this is something which has been consumed by people, and including the criminal justice machinery also. And this has basically created a kind of negative environment where she might be coming back, to the mainstream society, for seeking for a job or for seeking for some kinds of benefits, which right now may not be possible because everybody will be recognizing her as the wife of a sex offender, who in turn basically helped her husband to basically stay in the system as a person who can plead for more rights for the criminals. The question is that her rehabilitation, her questions regarding socioeconomic legal status had been completely ignored by the courts, which should have been done. And I'm extremely sorry to say that I could not basically access any other research in this or any other material in this which could have, exposed or which could have told me what is the present status. Because of the COVID lockdown, we know that entire thing got clamped down. And that is the reason that, she could not probably even access proper, assistance. The legal assistance also. Can we go to the next slide? So what we need to learn and what we need to notice, before this, I would go to the next slide and again come back to this slide. If you can go to the next slide. If any one of you can recognize the woman on my left-hand side, even she is also a victim of her husband's sexual offense. She is Dhananjay Chatterjee's wife, who was hanged way back, I think, in 2004. And here you get to see another victim in the same plight, that is Punita, who was hanged this year. I mean, her husband was hanged this year. In her case, she wanted her dowry back, again, going back to the socio-economic, legal, victimization. But, you can get to see her plight now. She is presently an Anganwadi worker living in a very meager income. And even if you get to see the media, if you go for data mining, you do get to see that she has been profiled in such a way that she wants to live, as the report suggests, peacefully. She wants to have her right to privacy. On her case, in Punita's case, you do get to see the court could have basically given an order that, when the hanging has been done, to consider about the rehabilitation of the offender's wife or of the offender's family, especially considering her as the victim of the entire system, including her husband's cheating. The court could have decided that, she should be given some kind of privacy, some kind of confidentiality to her child, and also the right to be forgotten could have been applied to tell the internet companies, to tell the media houses to take down certain offensive comments which have been, pressed against her. Now, again, going back to the upper slide, please. So what we need to learn, what we have understood from this, victimhood and support from the therapeutic jurisprudential aspects must be expanded to these innocent wives. I call them innocent because they are the victims of cheating by their husbands. Next is that application of cyber victimology to understand the liability of these stakeholders. Presently, for past 1 or 2 weeks, we have been going on seeing that, how Facebook is being addressed by the courts, especially for not taking down several comments, political comments or whatever comments, especially in relation to the present understandings about so many trending cases. This could have been done, especially when the courts could probably understand that because of the lockdown, everything will come to a standstill. Next, using the restorative circle to empower the wives of the sex offenders. I'm extremely sorry for the background noise. We are all working from the home, so this is the disturbance I have to live with. So using the restorative circle to empower the wives of the sex offenders, because at this point, I can basically say the PLVs, the panel advocates from the free legal aid clinics, especially in the districts, villages especially, where the where the women of such kinds basically are staying. They are basically coming from socio-economically backward community. The PLVs, the panel advocates, the legal aid cells, etc., the DLSA, they could have basically expanded their services to assist these women, especially to coming to the mainstream society after this traumatization. And the last slide, please. Yes, after this. So with this, I come to the conclusion, and I hope that I could stay in the present timing of this. My only suggestion is that we should see these victims of the sex offenders' wives from the perspective of the victimological angle and also from the perspective of the therapeutic jurisprudential angle. At the same time, we should also see for restricting certain trolling comments, certain bullying comments, etc., which are basically targeting them, not allowing them to even have a come back to the mainstream society, even when they want to have a proper profile, a proper life, even on virtual lives. Thank you so much.
Thank you, Professor Debarati, for critically analyzing the case of Punita Devi from cyber victimological aspect and therapeutic jurisprudence aspect and adhering to the time limit. So with this, we have finished all the talks for the first session. I'm sharing the feedback form link for the first session in the chat box, and I request all the participants to kindly fill the feedback form in order to avail the participation certificates. And I would like to extend my thanks to Professor Bajpai and Mr. Michael for their active engagement in the chat box and answering to the questions raised by our attendees and sharing relevant literature, articles, and web links. Thank you so much. With this, I would like to conclude the first session for the 9th International Conference on Victim Assistance, and we'll be starting our second session at 12:15, and all the questions that haven't been answered, we will redirect them to the respective speakers and we will get back to our attendees. Thank you so much. Over to you, Vipin.
Thank you very much, Shanky. And I again thank all the 4 speakers who have taken time and who have given the presentation. And as directed by Shanky, all the questions which will remain unanswered will direct it to the respective speakers and we'll take care of the same. So I will request all the attendees to stay online. In next 5 minutes, we'll begin with the next session. And we have all the speakers here. We are just waiting for one more speaker, and then we'll begin with the second session. So I'll request all of you to stay online, and I thank speakers of session 1 for their wonderful presentations.
Thank you, Professor Bajpai. It's always good to hear from you, and forgiveness. In fact, today I'm conducting a 195th webinar. In the last 6.5 months, we have conducted so many webinars, and forgiveness is something which we talk about, which is really helps for the mental health. So thank you very much for educating, and my dear friend Garkave, and we are waiting for you. Let the corona be over, and we would love to have you back. And then I'm really grateful to my dear friend Michael O'Connell and Professor Dr. Debrati Haldar. So thank you very much. We were just wondering that how it will go, but so far, even there are no technical glitches and things are moving well. So thank you for your time, and thank you, everyone.
Thank you very much, Dr. Sani. So we'll start in a while. I will request all the speakers who, if they want to test their screen, as Professor Beulah is doing. So we'll request all of you, if you want to do that, you can just share your screen and check. We have 3 to 4 minutes more. So, and then we'll subsequently move with individual speakers. So we have 3 more minutes. We'll wait for that, and then we'll proceed with session 2. I'll request all the attendees to fill the feedback form. It will also help us make a better, I will say, session and better conference in the subsequent edition that we'll do. So we'll start in a while. So by then you can utilize the time to fill the feedback form. Thank you very much.
Can we start? There's nothing harm starting 2 minutes before.
I welcome all of you. We have few speakers who have lined, and then we are finalizing the other speakers, but I will just start with our chair, and then subsequently we'll work around the technical aspect. So I welcome all of you on the second session, which is on victim and their victimization in times of COVID-19. And first of all, I would like to introduce the chair, which is Professor Beulah Shekhar. She is currently Emeritus Professor of Criminology at Karunya Institute of Technology Sciences. She was a professor and head of the Department of Manomanyam Sundarnath University, Department of Criminology. She's also our partner, knowledge partner for the 9th International Conference of Victim Assistance. And we are really happy and grateful to have her as part of the session. And she would be chairing the session, which is session 2. And I will request her to also abide by the time limit, because we would want to provide a smooth functioning of the entire session. So I will hand it over to Professor Beulah, and she can take it forward for her keynote, for her chair address, which is on victim to victimizer crossing the threshold, impact of unreconciled victimization. Over to you, Professor Beulah.
Arvind Tiwari And I could also see Annie there, but
Yes,
I see Garima Jain.
yes, sir. We are in calling her. So I'll just get back to her if there are any issues which is going. So all the three has joined. We are waiting Garima Jain to join. So please, Professor Beulah, you can start your presentation. Professor Beulah, I think you are on mute.
A very good morning, good afternoon, and good day to all our international participants. And I have to begin with thanking the host and my good friend, Dr. Sanjeev Sani, for this opportunity once again, and congratulate OP Jindal on the achievement of the Institute of Eminence. It was long overdue, I guess, and wishing you all the best in all the future endeavors as well. So let me take this opportunity to quickly share with you my ongoing research. I have just started working in this area, and I'm grateful for this opportunity to share this research with you. So as the topic reads, crossing the threshold from victim to victimizer, anger and the impact of unreconciled victimization. I think that is missing in the topic. So that is the key to this presentation. So during the pandemic situation as well, I've just completed research among commercial.
Yeah, okay, fine, just a minute. Thank you.
Among commercial sex workers in the red light areas, and I looked at their vulnerabilities, and I saw that they are now caught up in this debt trap. And this is one of the research I did during the COVID situation. And among all the emotions that evolved during these interactions with the participants of this survey and other victimization surveys, what was predominant was anger. There was hurt, there was sadness, there was helplessness, there were many other emotions, but what was predominant was this anger. So I tried to look at this anger and see, and very rightly said by Dr. Sanjeev Sani, how psychology and victimology are really, really interconnected. So looking at this anger from the psychologist's point of view and a victimology point of view. So I saw how this anger that went in and how it manifested itself. So let's look at this anger. What is this anger in, anger out? When we try to look at this phenomenon and try to understand it, we need to ask these basic questions, the pertinent questions. Who is this anger affecting? And when does this anger that goes in comes out? And where does it all begin? And why does it happen? Why does this anger, that unreconciled anger and victimization, why does it come out in these various forms? And what can we do about it as psychologists and victimologists? And of course, how do we do it? That is a very important question, and we need to answer it together. There's no one way. It is a multidisciplinary approach, and we need to all work together to address these pertinent issues. So basic things, let's look at the causes of anger. We know that unmet needs could be a cause of anger, then the feeling of being unheard when we look at victims in the criminal justice system and in other circumstances as well, and when they're unappreciated, when there's lack of acceptance in a situation. So this is looking at it across the board, across like victims of the criminal justice system, in the criminal justice system, and victims in the pandemic as well. So then the triggers, these triggers when this anger bursts out, this could vary from individual to individual, and the circumstances could trigger this anger. Some people who resembled the offender or the perpetrator of the crime could also trigger this anger. Sometimes the color of the shirt that offender was wearing, that could trigger. Then the smell, some places, familiar places, or places that the victimization actually occurred. Then anything that is remotely connected to their past victimization could trigger this anger. This is what we have seen. But the basic thing is this is all unresolved anger. So we need to look out for symptoms. And what could these symptoms be? They could be lack of sleep, feeling on the edge, irritability, frustration, criticizing, hurting others. So these are the outcome, the symptoms that we could look out for, and the outcome that would be both physiological and psychological. It could be rapid heartbeat, it could be increased blood pressure, it could be rage, aggressive anger, uncontrollable anger. So these are the various things when we're trying to look at anger per se. And how do some people experience anger when they're hurt? So when they're hurt physically, emotionally, financially, socially, and when they try to substitute this hurt with anger. So the feeling of anger instead of pain and hurt is what is predominant. So, and then this anger is reflected in the way they desire to hurt other people as well. And this anger manifests as irritability, internal restlessness, sadness, frustration, depression, anxiety, and many other things. Due to a lack of time, I just run through these things. And the results of unexpressed anger, this anger turned inward, it becomes sometimes self-hatred, it leads to low self-esteem and depression, of course. Like we see that many causes of depression could be anger, suppressed anger. So I'd like to show you this anger iceberg. So when you look at a person and you see that he's angry, we just see the surface, we just see the tip of the iceberg. So we need to look beneath that to see how this anger, where did it come from? Whether it was embarrassment, whether it was rejection, guilt, grief, insecurity, overwhelmed, the vulnerability, and many other things could be the possible cause of this anger that we see as the tip of the iceberg. So what I'm trying to say is anger is never a standalone emotion. It is always the result of unmet needs. It's a kind of a defense mechanism. It's a cause of depression. It creates a conflict within the person. It's an outcome of stressors as well. So I have little examples to show you how each of this works. So anger as a result of unmet needs. I read a very interesting book about young black men in America, how their anger towards their mothers, that was predominant, and that led them to get into many types of crimes and things like that. So this unreconciled maternal anger, the author calls it Morton Janks, he calls it unreconciled anger. So this anger, this anger is the cause of 10% of them being in prison, 25% of them being unemployed, and less than half of them are even high school graduates. So a generation of young boys and girls are coming out, being raised by their single mother. So their anger is towards their father who had either abandoned them or who had not contacted them. So the anger was actually towards their father, but more often than not, it was directed towards the mothers. So he calls it the red hot skewer. So that rage was anger was shown towards the mother who was there trying to make up for the absence of the father. So you need to shake loose the things that are unrecognized. Here the anger, it was unacknowledged, it was repressed, it was tucked away, it was buried in a place so deep in their consciousness. And then it came out as anger against the mother. So this was unmet need, the need for a father. Everyone needs a father figure. So that unmet need is what came out as anger towards the mother. So this is it's a very interesting book if you could get hold of it. And then secondly, we look at anger as Freud's forgotten defense mechanism. He spoke about a lot of ways in which we try to protect our ego from being hurt. So, but somehow he has not thought about anger. It's interesting that I was thinking about it, and I found that there were other researchers also who had talked about this. So mainly the psychologists who work in the field, they have seen that anger, even though it seems instantaneous, it seems like a knee-jerk reaction, it seems like it is something that happens when you're provoked, but actually there is some other feeling that gave rise to it. So this particular feeling is what they are trying to this anger is trying to hide, it's trying to camouflage, it's trying to control. But this is the feeling of maybe sadness or helplessness or whatever. So then you look at anger as a cause of depression. So everyone experiences anger, and sometimes it's short-lived, and sometimes it's long-term anger. And this long-term anger, it can be a symptom of depression. So researchers have found great connections between anger and depression. So there are many studies right from 1998 when they said they have observed people with depression and noted that 1/3 of them had experienced sudden episodes of anger. So again, the triggers may vary from person to person. And but the bottom line is you see that this anger is a root of also depression. Then we look at anger as creating a conflict within a person. So you see that how patients struggle with the experience and the expression of angry feelings. So these angry feelings, which are internalized, they cause conflicts. And this conflict inside turns out as guilt, and they disrupt relationships. So you see most of these victims who have moved over, cross the threshold to becoming victimizers. So these conflicts have led to anger, which is either directed inwards, leading to suicide and lower self-esteem, or creating violence. So defense mechanisms sometimes are used, other defense mechanisms are used to cope with this anger. And that could be sometimes like displacement, when the daughter-in-law the daughter-in-law is abused by mother-in-law, whose anger is actually directed towards her mother-in-law, and the road rage, when people go out and drive wildly, and their anger is actually with the boss in the office. So this is another way they have tried to cope. But anyway, the anger is there like a volcano waiting to burst at any time. So again, you look at anger as the outcome of stressor. There are many studies. Agnew has said that these stressors cause anger and frustration. So when these stressors, it comes from different areas. It could be environmental, behavioral, it could be negative life events, victimization, looking at it. So this would lead to this victimizing behavior. So there are many studies that find that it's a cumulative effect of all the stressful activity that happens in the family and outside that could lead to this anger and outburst and the related outburst. So we have seen that this stress and this strain could cause victimization and could cause a person to become a victimizer. Then moving on to anger as the cause of victimizing behavior among juveniles. Here again, we have a research done by my good friend, Dr. Wemmers, and she has found a relationship between anger and delinquency. So delinquency is actually victimizing behavior. So we see that the relationship between this anger and this victimizing behavior is very strong, and it's very, very positive as well. So as anger increases, so does the likelihood of the victimizing behavior also increase. So we see how this is again related. So you look at anger as a cause of victimizing behavior among adults. So that was with juveniles. And with this area, I've worked a lot. I've done a lot of victimization surveys, worked with students, worked in prisons, tried to understand what was the impact of the unreconciled victimization. So you see that when I did studies for more than a decade in different prisons in different areas to see how this impact of unreconciled victimization plays on the perpetrator committing an offense. So when you look at it, you see that in spite of all and this recidivism, that's another very important area. When they commit crime, and once they leave the prison, they go out and they come back as reoffenders. So what is it that's happening? Because we have them in prison, our theories of corrections are different now. We try to reform them, re-socialize them, rehabilitate them, and we try to accommodate them after their release. So in spite of all these efforts, what is going wrong? When they come out of the prison, they're back in another few months. So what's going wrong? Are we only looking at the outside? We think maybe it's poverty, maybe it's lack of family support. So we're trying to do that and get the prisoners the support they need and the finances they need to start a new life. But still we see that recidivism is on the increase. So are we looking only outside for solutions? Should we look inside the offender and see if there is some unreconciled victimization inside that needs to be addressed? So there is need for healing to happen within the individual. So that's what is important. So we're trying to work on a program for the prisoners, O.P. Jindal and Karunya. We're talking about it, Dr. Sanjeev Sahni, how to have a program for prisoners that look at their past victimization and addresses that and tackles that anger before we try to reform them and give them some other kind of treatment outside the prison and in the prison. So after these studies, we have realized that a large proportion of the prison inmates have experienced some childhood victimization, and that has not been reconciled with. So that is the anger that's there that's contributed to this behavior. And we look at these people as cognizable victimizers. They are possible offenders. So we need a program that would address this. I call offense dependency. So they have no other choice but to commit an offense. So it's like drug dependency and alcohol dependency. It would be offense dependency that we need to break, and we need to break these this vicious cycle. So unless we address that anger and that victimization, the unreconciled past victimization, can this be done? So anger as perpetuating the victim-victimizer cycle. So we see that there are a lot of empirical evidences to prove that, but nothing has been done to reduce the vulnerability of these people. That is why we are proposing this to the BPRND, and we're going to make a program that they can try out in prisons and see if it works when it addresses the victimization. Because with the COVID, there was a small gap in that. I'm sure we'll get working on this issue at the earliest. So again, yes, the breaking of this cycle. So we need to address the certain risk factors that can influence whether a person is likely to indulge in victimizing behavior. So that has to be tackled. And you see that there is an anger that is resulting out of all this. So the bottom line is addressing this anger. So when a person seems angry and he seems powerful and threatening, actually what he is it's a cry for help. It's a result of powerlessness. It stems because of his weakness. So we see that we've heard of wolf in a sheepskin, but I would say this is sheep in a wolf's skin. So this angry outlook is just a way of trying to cope with his victimization and his unaddressed victimization. So you see that anger in, anger out happens when the victimized and the vulnerable and the frustration and the anger related to it are all bottled up, and it comes down in the funnel, and then it comes out as a victimizer, as a criminal, as an offender, as a perpetrator of crime. So this is what happens. So the process, this is a process like the cogwheel. The helplessness churns, and then the anger is inside, and then that churns, and then what you have outside is the anger again. So you see that when there's no help, timely help given, when there is no assistance given, there's no reporting, there's no reconciliation, there's no healing, and internalizing happens. All the anger is internalized, anger, frustration. And when they're unable to cope, it comes out as victimizing behavior. So we need to break the cycle, and to break this cycle, we need to address that. We need to address the victimization by giving timely assistance and helping them cope with the anger or helplessness or the frustration before it turns into this all-pervasive anger. So in this context, I'd like to give you what Khalil Gibran has said. He said that the guilty is often the victim of the injured, and we who understand justice, how shall we, unless we look upon all deeds in the fullness of life? We cannot separate the just from the unjust, the good from the wicked, for they stand together before the face of sun, even as the black thread and the white thread are woven together. And when the black thread breaks, the weaver should look into the whole cloth, and he should look at the loom as well. So we need to understand what is behind each one's anger and the victimizing behavior. So it's very common to say wolf in a sheep's clothing, but it's very difficult to picturize a sheep in a wolf's clothing. That is what an angry person or a potential victimizer is. So he's really, it's his hurt and helplessness that comes out as a wolf, and that angry face that is. So we need to look inside a person to see what exactly it is to address it. So I hope I've stayed with time. I rest my case. Thank you for your patience. And yes, I welcome questions and comments. Jai Hind.
Yeah, thank you very much, Professor Beulah, for your insightful session and the address that you have given. We'll take all the questions at the end. So I will now put forward the second speaker in front of the audience, which is Professor Dr. Arvind Tiwari. Professor Dr. Arvind Tiwari is the Dean of School of Law, Rights and Constitutional Governance and a chairperson of Center for Police Studies and Public Security, Tata Institute of Social Sciences, India. He has been president of Indian Society of Criminology for a long time. He has been dedicated in the empowerment of criminology and criminal justice system in India. And with his address and the presentation that he would be delivering today is on mental health and well-being with reference to victims, especially in times of COVID-19. So I will hand it over to Professor Arvind Tiwari to address the audience of the conference. Over to you, Professor Tiwari.
Thank you, Mr. Vipin. And good morning to all of you. Good morning to Professor Beulah, Professor Sahni. And I would like to, at the outset, I would like to thank the University Vice Chancellor, Professor Rajkumar, Dr. Sahni, Mr. Vipin, and all of you for giving me this opportunity. So, as how much time, Professor Beulah, I am having?
15 minutes.
15 minutes?
Yes.
Okay, fine. So I do not have any presentation. I would be speaking on certain issues. So as has been already presented to you, and I would be talking about, because I have been asked to speak on mental health and well-being with reference to the victims. So I would be confining my discussion on the crime victims and the victims of abuse of power. What kind of difficulties they are having, and how we can think of some kind of alternate models for healing and some kind of community support system besides the government support system to them. So friends, as we all know that according to the WHO estimate, around 7% of our population, Indian population, has some or other kind of mental health related issues. Now, in such a, if we'll see the volume in terms of the number, as in proportionate to the population, it is huge. But vis-a-vis, if you'll see the mental health services, we have the Mental Health Act 2017, which is revised, and the new act has come in 2017, which is in force since 29th May 2018. So now Mental Health Act covers the huge gamut of the kind of services provided and the mechanisms to address the mental health issues in general, and for prisoners and in prisons and other kind of institutions, custodial institutions also. But if we will think of what kind of issues would be there for the crime victims in terms of health first, then mental health, of course, because you see, once victims are traumatized and crime is happening, the first response should be given by the family and by the community. So here is the problem, because if you'll see the victims of different kinds, for example, property crime victims. Now, what is their preference would be? Their mental stress would be that how we can recover our property. Like you have seen in Sahara case, the Supreme Court of India has not granted the bail to Mr. Sahara till he has not deposited the entire money, because the hard-earned money earned by the people, which has been invested in the various projects, although it is the real estate related issue and may not be the criminal offense per se. But if you will see the changing paradigm of crime and the victimization process, it is huge. See the changing paradigm of crime, like all development induced crime and the victims of that. See all kind of financial crimes, white collar crime, and the victimization through that. So the victim, if you will see the crime victim per se, it is not only the traditional crimes, the property crime, crime against person, these are worst affected, but also the victims of white collar crime, the victims of development induced crime, for example, the mafias, all kind of mafias. They are, the whole community is the victimized. So let us think that how the individual victims can be supported. What kind of difficulties, as Professor Beulah has jotted out. These are the overall kind of issues which the victim would be having. Victim may having the trauma, victim is having the depression, anxiety disorder, and also risks of further victimization, secondary and tertiary victimization when the victim goes to the system, how the system is treating to the victims. Despite several efforts, we know, I would like to tell you, or some of you may be aware also, like one-stop center. After Nirbhaya case, one-stop centers have been set up. And this scheme is sponsored by the Government of India, Ministry of Women and Child Development. Many places these centers have been set up, but these are not efficiently, all of them are working. Because the whole idea of one-stop center is that particularly the victims of rape and the victims of gender violence, they must get support, medical to counseling, all kind of necessary support under one umbrella organization, which could be linking them to the medical care, to the counseling, and other kind of rehabilitative needs. So this is one of the area that, although the scheme is there, but how scheme is being implemented. Second issue is regarding victims of crime. The support system is, if we will see the CRPC, section 357A, often in law, debate in law and criminology and victimology, we are talking about that, yes, there is a scheme under 357A which will give the compensation and the financial support to the victims of crime. This scheme also has two more ingredients. One is the compensation to the victims of crime. Another is the compensation in addition to the fine imposed by the court after the conviction. And third, the treatment for victims. Now the treatment includes everything. That includes the health and other kind of, but if you will see the support system and the sensitivity of the doctors and the local police and even the victims, legal authorities, DLSA, District Legal Services Authority, should also provide them legal aid of all kinds. But are these support systems available to the victims? Number one. Whether victims are themselves aware regarding these things, that is number two. So what I feel very strongly, that the victim support system and the mental health related issues and well-being of the victim, because well-being of the victim would be at 2-3 level of satisfaction. One, that victims should be treated properly by the family, by the community, by the neighborhood, by the friends, number one. Number two, when victim goes to the criminal justice system, that is the police first agency, victims should be treated with dignity and respect. And all support services under this scheme of either DSLA, DLSA, or one-stop center should be provided to them and guided to them in such a manner that their anxiety and depression could be healed up to an extent. So this is another area. Third area, what I feel like, the victims of the crime which are being generated through the structural issues, like for example, see the social, cultural, economic, political, religious structures are also creating a lot of violation of rights of the people. For example, see the domestic violence. Now, in the gender debate, we always talk, and our constitution has provided equal rights to everybody, men, women, and all. Like Navtesh Singh Johar has also expanded the scope for LGBT and all these groups. Everybody is equal before the law, and all people are having equal rights. There should not be any discrimination on any basis. However, domestic violence, to an extent, if we'll see the National Family Health Survey report, you will find that around more than 30% of women across the section of the society, educated, from well-to-do family to middle-class families, they have accepted that yes, there is some or other form of domestic violence is happening, and all violence is not being reported because of the family reputation and several other social reasons. So now the stigmatization of the victims cannot be dealt with until unless we are not indulging, including the legal reform, including the social, cultural, economic reforms at the lowest level. And these reforms are coming slowly because of education, because of media. Media is also spreading a lot of information. But I think there is a need to reach out to the masses through Panchayati Raj institution, community mental health. What I feel that there is a need that at the community level, lower level, the Panchayati Raj institutions through three-tier of Panchayat system have been giving a lot of powers in terms of development issues and all those. They could be the first responder to any kind of victimization. And if we can also in simple modules or in very different innovative ways, we can reach out to them through social media and other kind of media. And then they can also be linked. There are several kind of, you see, government officials like health workers, Anganwadi workers, and PHC level, at the local level, the school teachers. There's a need that we have to bring out, develop first the module in a very simplified local language, and we have to reach out to these institutions and individuals, and also the victimization and the cause of victim and the problems of victims, including their mental well-being and difficulties faced by them, should be addressed in a holistic manner in such a way so that the victims of crime are being taken care of initially. First thing, there should not be stigmatization. For example, if there is any kind of rape or any kind of physical violence or any see the exploitation of children, how the sexual exploitation of children within the family. Where is the pride? Honor killings, the caste-related issues, and the stress on the victims. So we have to address these issues. The first respondent should be the community, and we have to link community in such a manner that communities will also feel that yes, they are engaged, and for that, as we all know, there is a need to have the structural reform in the criminal justice system. Slowly, after Justice Malimat Committee and after amendments in the CRPC and the laws and progressive judgments by Honorable Supreme Court and High Courts, the victims' rights are advanced, and victims have right starting from filing FIR to the final filing of appeal and everything. But victim impact statement and several issues are still unaddressed, but slowly the system is taking care of that. I have conducted a study for BPRND on non-registration of crime in among 8 states, and I have spoken to, my team has spoken to around 800 people, including victims and other stakeholders. And their major concern was that, you see, when the crime has occurred, the first problem was from the local community. If the crime is of such nature, domestic violence, other kind of thing, then there was resistance from the community. Okay, chalo, this is fine, okay, this is the honor of the family, why not you compromise this, that. And second trauma was when the victims have gone to the police station to report the crime. DSLA is missing from there. There is no legal aid. Although the DLSA and the Legal Services Authority Act also mandates that all victims, accused, everybody should get the legal aid. But that is not happening several times. So what I would like to suggest, that there is a need that we have to see that how at the local level the support system could be provided to them, how we can expand the community based some kind of support, because that is the best support system. Because in our country, if you see the psychologists and psychiatrists, the number is very less. Even for essential services, the psychologists and psychiatrists are not available, either not available or government is not recruiting them. So there is a need that we have to develop the community-based mental health program and well-being program, so that the depression and other kind of difficulties initially faced by the victim. Then PTSD, post-traumatic stress disorder, and particularly in violent crime and other kind of crime. And like see the state crimes, the victims of state crime. One of my students was doing PhD on the custodial deaths in police custody. And he has interacted several victims, next of the kin, and the neighbors and families of the victims, those who died. And it was horrible them to face the justice system first, and also the community support many times was also missing. So therefore, there is a need that we should think of the community support system. We should also see criminology student, law students, victimology student, psychology and social sciences student, law. They should also see that this Mental Health Care Act in 2017, which is amended, very elaborate act, how this can also be utilized, and also the institution which have been proposed and mandated under this act, whether they are functioning well, what are the challenges faced by them. So there is a need that the victim support system and the mental health and well-being of the crime victim should be dealt at the community and at the state machinery level. So here I would stop. I would welcome any observation or any suggestion or questions by the participants. Thank you very much.
Thank you very much, Professor Tiwari. It was really an insightful address by you, and you focused on the mental health and well-being of victims during this time. So we'll take the question and answer at the end. So I'll request all the participants to drop down the question directed to one or the other speakers. So we'll take that at the end of it. Now I would like to call upon our third speaker. I'll call Ms. Garima Jain, who's a co-founder of Cycling, and she is a PhD candidate at Intervict, Tilburg University, Netherlands. And she would be addressing on narrative victimology, understanding what justice means for the rape victim. So I'll request Ms. Garima Jain to focus on the particular address. Please go ahead, Garima.
Thank you, Vipin. Am I audible?
Yes, you are.
Okay. So good afternoon, delegates. Respected Emeritus Professor Beulah Shekhar, Dr. Arvind Tiwari, Dr. NSA, and my special thanks to Dr. Sahani. It is my absolute privilege and honor to be a part of this prestigious international conference on victimology and victim assistance. Today, the topic of my presentation is narrative victimology, understanding what justice means to the rape survivors. My presentation today is a product of my PhD dissertation, which I'm pursuing from International Victimology Institute, Tilburg University in Netherlands, under the guidance of Professor Mark Groen-Huijsen and Professor Sahani. Am I?
You're audible, Garima. I have shared the screen. You can go forward with the presentation.
All right, okay. So the recent incidents of Hathras, Priyanka Reddy, Kathua has raised pertinent issues related to crime against women and children. National Crime Records Bureau recorded the cases under POCSO in 2014 for the first time, whereas the cases on crime against women was recorded in 1971. Since the first reporting in 2014 till 2019, the POCSO cases have recorded an increase of 347%. On the other hand, rape statistics between 1971 and 2019 have shown an increase of 1,241%. Next slide, please. It is worrisome to record that pendency of the child sexual abuse cases for investigation is nearly 30% during the last 3 years. And this situation is in gross violation of the section 173, 1A of the CRPC, whereby it is stipulated that the investigation in relation to rape of a child may be completed within the 3 months from the date on which the information was recorded by the officer in charge of the police station. Despite special POCSO courts and special prosecutors enabled by the enactment, the pendency of the cases is increasing every year. And as we can see in the charts, In 2019 and 2018, 90% of the child sexual abuse cases were pending for trial. The cases of rape and other sexual offenses under the penal code have almost similar fate for languishing in the trial courts. Further, the conviction rate ranging from 25% to 35%, and it is worrisome for all kinds of sexual crimes, irrespective of registered under POCSO Act or the Penal Code. Such poignant feature of criminal justice administration is called justice gap, and how we call it as high attrition rate. Professor Mark, in his highly engrossing article on victimological aspect of reporting and non-reporting crimes, cited how sexual violence as a crime is underreported all over the world. Therefore, it is important to understand the process of justice in the formal criminal justice system. Next. Justice in the context of sexual violence is commonly equated with positive outcomes, usually a conviction and punitive sentence from the conventional criminal justice system. Justice is often, we find justice in understanding in a dichotomous way. Either you get it or you don't get it, a conviction or not, which is going to be one of the objective of my today's presentation, where we are going to understand the justice in the formal criminal justice system by analyzing the victims' narratives and their aspects and perspectives and their experiences in the formal criminal justice system. Before I went on to my cases and towards my study, I just wanted to point out on understanding what exactly is narrative criminology. While narrative criminology focuses on why they harm by examining perpetrators' perspective, narrative victimology, it focuses on how people experience a harm or a trauma. It focuses to understand what has been done to the victims and its subsequent impact on self-esteem, autonomy. It unravels the influence of trauma or victimization on the life stories of the victim. And it also gives an opportunity to look at the justice provided by the criminal justice system as encountered by the victims. As I've already told you, one of the objectives of my presentation today is to understand what justice means to the survivor of the rape and their family in the aftermath of the victimization. And second is what is the importance of victims' narratives in the formal criminal justice system of India. I would like to brief a little bit about my methodology. I have conducted ethnographic accounts of the victims and their families, and the cases I have been able to reach out to them through the crisis intervention centers, and I interviewed over 36 cases, whereas I reached out to 67 cases, but because most of the cases, almost 50% of the cases, they were relocated or they were not present, or it was very difficult to contact them. So therefore, out of the 67 cases, I was able to get in touch with only 36 cases. All the cases I interviewed were registered after 2014. I conducted ethnographic interviews of the victims, their families, lawyers, magistrate, judges, and the police officials involved in this case. Because of the paucity of time, I'm going to basically focus on the two cases. In the one of the cases, the accused was convicted, and in another case, the accused was not convicted. In the case one, Narayan lives in a small slum below one of the metro stations in Delhi. He earned his living by selling ice cream. And one evening in December 2016, her 5-year-old daughter went out to play. When she didn't return for 2 hours, her mother, Geeta Bai, went out for her search. She found her daughter's cry in the neighborhood. She found her injured and was distraught to learn that she was sexually abused by their neighbor. An FIR was lodged immediately under POCSO Act 2012. The case was registered with the Crisis Intervention Center. As I was following up with the case, I met Narayan and his wife in January 2019. Extremely hesitant initially, they met me in the metro station. And one of the excerpts from his interview, which I would like to cite today, says, "I don't know what happened in the case. I don't want to know. She is 7 years old. Nobody believes me. We are so scared that if that person comes again and harms my children, who knows who will protect us? Nobody helps. We have to help ourselves. I have destroyed all the documents related to the case. I don't want to go to the police or the court." Using the FIR copy, I went to the police station to inquire about the case, where the officer in charge of the documentation department told me that the accused was convicted in 2018 and he was imprisoned for 10 years. I also went to this Rohini District Court and got an access to their judgment copy, where I found that the court has ordered a compensation of 5 lakh rupees to the victim and her family under the victim compensation scheme. Now, this is such a surprising fact that the accused was convicted. The court has ordered them a compensation of 5 lakh rupees, and the victim and her family were unaware about the entire justice that took place. Yes, the conviction has happened, as we understand, in the binary form of conviction and non-conviction, but whom are we serving the justice to is a question that we need to answer. Broadly stating, the goal of the criminal justice intervention in a case involving intimate partner abuse or rape is to punish the abuser and to protect the victim, who is a witness and not a party to the action. Another point which needs to be discussed in this case is the moralization gap, a term which was coined by the Steven Pinker. Moralization gap is the difference in the account of victims and the perpetrators. Victims saw the event as injustice, stressed the impact, minimized the context. Perpetrators, on the other hand, tended to find justification for what happened, attributed the event to the outside causes, minimized the impact on victims, and saw the event as a moment in time. What is the problem with the moralization gap within the context of criminal justice system is that victims' perspective in the moralization gap reflects the experiences of the actual victims, while the constellation in which they find themselves in the justice process confronts them with the perpetrator's perspective. In the Narayan's case, the preference was given to the reporting of the facts, while viewing the narrative, especially the highly emotional ones, with suspicion. They were relocated. They were the ones who moved from one place to another. There was a clear lack of participation of the family in the entire criminal justice process, and they were merely seen as a witness to the crime. Another point that I would like to put forward in this case is the two big framework which has been pointed out in a very well cited article of Pemberton called Agency and Communion, which help us further understand victims' perspective with justice. In the aftermath of the victimization, the incident of the sexual violence, survivor generally experience powerlessness, diminishing sense of competence, loss of control, loss of status and honor, or what we call as agency, which is clearly the case which has happened in this particular case which I have cited. Another case in which there was no conviction. Hasina Bain has 4 daughters and a son and live in a cluster along with her husband. One evening in 2017, Hasina Bain's husband Abdul brought 3 friends over to their home. All 3 were drinking till late evening. All his friends left. He told his daughter Noor Nisa, who was 10 years old at that time, to go buy him bidis. As Noor Nisa started to leave, he accompanied her and took her to an isolated place located at a distance from her house and raped her. After they have been missing for 3 hours, Hasina Bain got worried and began a frantic search for her daughter. At midnight, Abdul walked Noor Nisa, who was severely injured, home. She told her mother what happened. The next day, she went to the police station, but police did not file her complaint immediately. She took her daughter to the hospital for treatment of her injured feet, but did not got her internal examination due to the fear of the word spreading in the neighborhood. Next day, he saw her husband forcing himself on Noor Nisa again. She couldn't resist and went to the police station along with her daughter, and Abdul was immediately arrested. FIR was lodged. I met Hasina Bain in December 2018, and I found her living with her 4 children along with her husband when I went there. It was totally out of my surprise when I saw the husband right there. And in one of the interview excerpt that I wanted to cite is, I took the case back. She says, who I was fighting against, he is my husband, and he has changed. No one believed that a biological father has done this. I have 4 daughters. After fighting for 6 months while he was in jail, all my daughters were exposed. Who would have protected him? No money to fight the case. For me, justice is the safety of my children, and now they are safe. He got his lesson. Noor Nisa doesn't stay with us. She lives with my mother in my native village. Where she is not here, nothing will go wrong. While rape is a non-compoundable offense in our country, Pratiksha Bakshi, in a highly engrossing and well-cited ethnographic research on rape trials, stated that it is well-established fact that the pressure to compromise in the rape cases is enforced to the functionaries of the state institutions responsible for the investigating a case, including the officials of the CBI, policemen, lawyers, and local politicians. The spectacle of compromise desired by the society, police functionaries, lawyers with the influence of local politicians in the realm of restoring the honor of the family and community, the rape cases remain underreported and underconvicted. In this case, it is clearly a case of compromise because the father, who is the sole bread earner of the family, is the one who is accused, and the mother and the victim cannot afford to convict their own father in this case, their own husband in this case. Another point that needs to be discussed here is framing and stereotype that cause the victims difficulties, whose stories in one way or the other doesn't conform to the stereotype. For example, legitimate victims are those who do not have a relationship with the offender. But the NCRB report of 2019 says in a very disturbing statistics that more than 90% of the accused are known to the victims. With the victims who moved to the native village away from her family, sacrificing her future because of the wrong done by her father raises a pertinent issue of voice. After meeting the family of the survivor along with the functionaries, I found that justice is something which is individualized. It is not something which is a binary, which is understood in the form of whether there is a conviction or not. In the end, I would like to cite the social science professor Harvey Winston and Eric Stover, who says that justice, like a beauty, is in the eye of the beholder and can be interpreted in a variety of ways. For many of our informants, justice means having a job and an income. For others, it was returning to the home they had lost. Still, others saw justice as the ability to forget the past and move on to their lives. For others, justice has to be exacted by the revenge. Some said justice could take place once their neighbors took them away in the eye and apologized for betraying them. Thank you. I'm very happy to answer any questions. Thank you.
Thank you very much, Garima, for such an insightful address that you have given, and also sharing your findings from your PhD dissertation. And also, I would like to thank you to adhere to the time limit that we have provided. So now I would like to bring forward our last speaker for the session. And the last speaker is Dr. Annie Eching Esse, who is a senior lecturer and chairperson at Department of Educational Studies, School of Open and Distance Learning at University of Nairobi, Kenya. And she would be talking about escalating cases of sexual violence in universities, silent suffering victims. I'll hand it over to Dr. Annie, and I'll request her to adhere to the time limit as provided earlier. Thank you very much, and you can proceed.
Okay, you are sharing my slide. Good morning, good afternoon, good evening, everybody. Thank you, and I'm happy to be here. I thank the organizers and other participants. Vipin, you have my slide?
Yes, I'm just sharing. Yeah.
Okay, thank you. So I'm looking at escalating cases of sexual violence in universities. Why universities? I'm looking at a very vulnerable population, where if we don't take much care, we may not have Professor Emilio and others who will be helping the society. So it's a very delicate group of people. And there's a lot of sexual violence going on in these universities, which are not being reported, nor are they handled in one way or the other. Yeah, so my continent, Africa, is at risk. We are at a very high risk also, just like Asia and any other continent. So we have to look at ways and means of addressing these issues. And next point. Next slide. Okay, I'm based in Kenya. So I'm looking at my country, Kenya, which the population of 47 million people. University education is managed by the Commission for University Education. University education has been on the upward trend from the 1970s, where we had single university, the University of Nairobi, where I'm seated, and a single private university known as the United States International University. Since then, the growth has been quite high. We currently have 33 universities for the government and 26 private universities and other colleges. But this growth has not been commensurate with other issues like student accommodation, the services which have been mentioned. What services are we offering? We have approximately now 125,000 students joining these 74 universities every year. But how prepared are we to accommodate all these students? Are we giving them the best? Are we checking whatever is going on in the universities? So my research has been based on looking at violence in these universities, especially violence, sexual violence in these universities in Kenya. So I work with some students to get information, and also the universities and my fellow lecturers. Okay, next slide. Okay, so the types of violence have been mentioned here, intimate violence and others. All these are happening in these universities, non-intimate violence, sexual violence. Okay, next, because of time. So just psychological violence, emotional violence, gender-based violence. And then the new one, which I was given by the students, is economic violence. This is a very interesting scenario where students fall victims to fellow others because the girls want to benefit from the boys and the boys want to benefit from the girls, and it leads into marriages in those hostels, and those marriages leads into sexual violence, leads to death, suicide, and every other things. Yeah, so next slide. Yeah, so who are the perpetrators of all these aspects of violence in the universities? My number one is politicians. Why do I target on politicians? From the research I'm doing, I'm told that sex in the university is trade. It's a business. Some people are in parliament because they've been selling girls to politicians. They take the girls from the hostels to politicians, and the politicians give them money. The politicians also give these girls to other businessmen and other people. So it's a trade, it's a circle of trade, which has a lot of money. Depending on the course the girl is doing, depending on the background. So the girls are not paid, but the student who has taken the girl is paid. The politician pays the student, then the girl is given some little money. So they go and have sex with the girl, comes back to the hostel, somebody is paid, and the girl is given something small to sustain her. So politicians was number one in my list from my research because of the trade. Yeah, your girl is at the university, but it's more like a trade. Then the businessmen and businesswomen are also involved. So I know that you coming to the university will become a business for some people. The relatives, the other perpetrators are the parents. Yeah, some parents don't know what their children are doing in the university or whatever is happening to them. The acquaintances, yeah, some girls giving fellow girls to other men to be raped or to be sexually misused within the university or outside the university. Then the other group are fellow students, both male and female. You realize that the male have dominated the girls, so they can easily give them to other men outside, to the politicians, or sell them, then they are paid. Some are driving because of selling girls in the university. Then there's the security. The security have not protected the girls so much. The security, I may not blame them because when I talk to them, I realize that they don't know what to do. The girls are there and everybody else, but they are not trained on what to do, yeah? So for example, I just give one write-up. On Monday, 13th May, university student X, I will not give the name, became the most recent victim, stabbed to death by Jos, a man she had met on social media platform. So you see how our girls are vulnerable, yeah? So Abby, the second one is Abby was found dead at her house near the university she was attending. Police suspect she was murdered by her boyfriend, Nyanges, who was found hanging dead in the house. So the boy dies and the lady also dies. So Geta was hacked to death with a machete on 19th April by Nation, also a boyfriend who later claimed that unrequited love had led to him committing the heinous crime. So these are cases of 2019. They are not historical. Yeah. So this is just an example of the scenario we are going to. So how impactful is sexual violence in the university? These students, these are university students or just recent graduates of the university. We lost all of them in 2018. These are just reported cases. So it made people come up with the idea of how life matters. So the politicians and everybody else was concerned. So what is happening with the university students in Kenya? What can be done? We have so many victims, yeah? This is just a section of 2018. So we lost all these girls. Some of them, they were just doing their practicals, they were aware. So one was even a victim of a politician, the people of very high status. So, but who is protecting the girls? Yeah, next slide. Okay, so what are some of the causes? There is the aspect of freedom versus reality. When you see the up picture, you can see the girls as they transform. When they join the university year 1, they're very innocent. Year 2, they start changing their style. Year 3, now you can even see their dressing is somehow somebody who is now not ready for anything, yeah? So when you link the photos also to the other side, some of them come from those other background, the lower photo, whereby, yeah, here where the student is, they're born into the slum or they're born in the low background. They come here, this is Nairobi, the other side, the eastern side of Nairobi, whereby this is almost near the University of Nairobi where I am. It's just some minutes, some 5 minutes. So here there's a lot of abuses which goes on. Yeah, because the girls don't know. He believes that if I come from this one, I move here, I must change my lifestyle. So he comes when he's well-dressed. Second year, he's good. Third year, the girl has changed. So the abuses starts the second year, the third year, and even the innocent first years. Yeah, so that transformation, these girls have been from gated communities. They're from gated high schools. They move to the university, there's freedom. All the gates of the university, you enter, you move in, you move out. They are from their parents' houses, which is locked, they're everything. Yeah, so when you give them that freedom, what is it? Am I supposed to learn or am I supposed to go out? So that freedom also impacts on them. Next slide. Then another cause is narcotics. From my research, I realized that there are a lot of drug abuse in the hostels, in the universities, among the students. We may lose even a whole population whereby we may not have future Emilio, we may not feature Bagpai and others. Who will talk about the university? Who will educate these students? Yeah. So my research has found that there's a lot of drug use and abuse in the hostels. The girls are involved. In one university, I was told that more girls than boys take drugs and they don't care. Yeah. So we need to look at, because there is peer pressure, there is academic pressure and everything, but psychologists and others need to work together and see how do we do away with the peer pressure? How do we make them human beings? Okay, next. So the other causes are poverty. There's the aspect of lapsed security. Security within the universities are not trained to handle any victims of circumstances. One told me that we don't know. For us, those are criminals. We take them to the police, they're beaten, and yeah. So even the boys who commit the crimes, you can hear a case of rape, but the security tells you, as we don't know. Those are criminals. We take them to the police and they're beaten there. Then the girls are poor. There's lack of relevant knowledge. They don't know that if these things happen to me, I'm raped and what are the procedures of what I can do? No mentors. The girls told me that nobody is telling them. They see the lecturers or other academic staff or non-academic staff, they drive into the university, they only see their cars, they go to class or they go to their offices, life stops. So the girls and the boys are left on their own. Can you talk among yourselves? But what do they talk about? Do they know what they're supposed to talk about? So lack of role models, weak support services, which has been talked about by my colleague Vint, who talked of weak support services. How are we helping them? Are we identifying the victims and ensuring that there is some procedures in which these people could be punished? And yeah, everything just goes on smoothly. People have been, they're victims, there's no procedure, nothing is followed, they go back to class, the girl suffers for the rest of her life. Okay, security labs, ladies hostels are walk in, walk out, especially at the universities in the cities and even in the villages. I've told you there are no gates, there's nothing. Anybody can walk in there, can walk out there. So we had a case of attempted rape. Somebody just walked in and open the girls' room, and there it is. So there's need to have some procedures. That's why I was started by telling the rise in the universities in Kenya and the rise of the number of students joining the university. Are we taking care of them? Their hostels, where they are staying, what are we giving them? Yeah, relevant people like security need to be trained. Then another one is the issue of marriages in campuses, which needs to be controlled. Female students don't know their rights, even the personality. Some, if you talk to them, I was handling a case of whereby one was raped and they didn't want to talk about it. They say, what do I do now? The man will beat me when they know they'll kill me. So there's a lot of fear among the girls, yeah? So the male dominance, the male has dominated the girls. You told of cases whereby the male take their electronics and everything, laptops, they start fighting, the man beats them. The case is taken to the security, they are criminals. You don't know, they are criminals. We've taken them head. From the police, they bribe their way, come back to the hostel. The story continues, yeah? So then another challenge which we had, I realized that 70% of universities in Kenya have no policy on sexual violence. Yeah, even the Commission for University Education have no policy of sexual violence. They don't know what to do. There is no clear guideline on what happens, what is the next stage. Next slide. Okay, so some of the few strategies which has been in place here is that we have developed something known as My Life Matters within the university and the upper community, the politicians and others. We look at what is it, yeah? So for example, this is a case of a student who was raped by a lecturer. My life before university consisted of school and my parents, she explains. I didn't know what university was going to be like. I just thought, why are all these things happening to me in these normal circumstances? So this was a case of a girl who was raped in 2018 by a lecturer in the university premise. So when you follow the case, it's a very sad happening that it stopped somewhere. The case has stalled, yeah? Then one said, I fear I might be pregnant. So this is a case of a girl who was raped. Then he's saying, these are the cells in town whereby the girls are taken there by fellow girls or fellow boys there. They start talking, then in the process, they are confused and they are raped through the drugs and the rest. So I fear I might be pregnant. Just engaged in sex with a guy I knew that night from a dingy club in River Road, Nairobi. And her friend escaped, yeah? So these are the scenarios we are having. What are we doing about them? Next. Okay, I think I'm going to. Okay, so the perpetrators need to be punished, but how do we punish them? We need some aspect of victim analysis, victim identification. There's a need for people to work together. There's need to know from the psychologists, there's need to know from the law enforcers, from the security, from the university management, how these perpetrators can be punished, because most of them are going scot-free. It's the girls who are remaining here suffering psychologically, mentally, socially. The perpetrators just go scot-free like that, yeah? There's need for clear university policy on students' admission and space. We admit so much, we admit so many, but we don't have space for them. Can we have space for them to ensure that they are well taken care of, they are safe? Yeah, especially the girls are vulnerable members of the society. Because one security guard told me that most of the cases reported of rape, abuse, fights, and the rest, it's the girls who are beaten, most of the legs broken are the girls, the hands broken are the girls. So can maybe the universities take more precautions as they admit the girls and that they come to the university? What can be done more than they are doing? Strengthening security, the girls in the hostel, creating training for security and for staff. One student told me that peer-to-peer training is quite good for them. They understand one another. When one is abused, they can see what to do. What can we do to train the girls, especially on victim identification, and also on what the law of their country says. Some of them don't even know what the Constitution says. Some of them don't even know that they have rights. So there's need just to give some basic training as they come to the university on what is their rights, what can they do in case you are raped. Yeah, in case you are abused by a man, in case you are abused by a fellow girl, in case you are being sold out to politicians for money, somebody becoming rich because of somebody's daughter coming to the university, what can done. So there's some basic need to train them on some basics on that. Yeah, strengthening the role of mentors and mentees. We need to work together, and clear policy on how to handle university students being raped. They need to know law and order. Then there's also need for poverty reduction strategies among needy students. Most of these students who are involved in these things are needy. Those who are sold out are needy. They come from the slum, they come from poor backgrounds, they reach universities, the gates are open, everything can happen. So there's need to reduce on this poverty. Can we give them bursaries? What can we do for them to ensure that the girls have enough to eat, the boys have enough to eat or enough to survive the university, so that they don't sell the girls. Yeah, very soon they'll be selling fellow boys, or maybe they sell them and we don't know. So gender reporting desks at focal points. Universities should have some gender reporting desks at focal points, because I realized that the girls were telling me there are rape cases, but when I went to the security, we were told that we don't know. What are you telling us? Yeah. So there's need for some reporting desks at some particular points within the university. Then lastly, partnership and collaborations with relevant stakeholders. We need to work as a team. We need to work together with others, the victimologists, the criminologists, the psychologists. Otherwise, we may not have future professors. We may not have future people to teach at Jindal and other places, University of Nairobi, wherever and where. So we need to work as a team to ensure that all the students who come to the university, whether girls or boys, are protected. Thank you.
Thank you very much, Dr. Annie. It was really a wonderful insight where you shared your experience in terms of where university students are facing, what university students are facing, and in terms of sexual violence. So thank you very much, Dr. Annie. So I think we have still some time left in terms of question and answer session. So I'll just request all the participants, if you can just type down your questions for session 2. You can direct it to any of the speakers and I will take those questions. So I'll just go through the chat to see if there are any questions. I'm happy that the speakers are taking out time and reverting to question in the chat room. So we would have less questions to be taken directly. So I'll just take 1 or 2 questions which are pointed out. Yeah. Okay. So I think there's one question which points out to Professor Beulah. They wanted to know about your perspective in terms of victimization, which happens in prison, and even in terms of other speakers who have pointed out, if you can just lay down your point of view in terms of the scenario in prison, especially in terms of COVID-19, if you can highlight that, Professor Beulah, and then I will take up if there are any further questions.
Victimization that I looked at in prisons, thank you for the question. That was their past victimization is what I had looked at, their childhood victimization. So victimizations in prisons per se was outside the purview of my study. Nevertheless, we have the second part of the UN declaration which deals with victims of abuse of power. So whatever happens, if it happens in the prisons and the prisoners are victimized by the supervisors, it would fall under the Human Rights Act as well as would be covered under the abuse of power part 2 of the UN declaration. And having said that, the COVID situation, I think actually the people inside the prison, they were in a safer spot than the rest of the people outside, because they had less contact with people from outside unless you had people coming in and giving them the COVID. So I do not have the statistics offhand, but my perception is that they would safer because they were inside, and unless an outsider gets in and gets the infection in, then they would need to tackle that with the other social distancing and masks and whatever. So I think they were at a better place at this to face this pandemic because they were in a closed circle is what I would say.
Thank you very much, Professor Beulah. So I think the second question which is directed is towards Dr. Annie, and over her presentation which focuses on, and the question focuses on that, in your perspective, in your point of view, what are the different policies and measures taken by academicians and people who are in universities to tackle sexual violence in university level? So anything that you have come across in
Okay, as I do my research, I come across quite a number of lecturers doing research in the universities, but most of the research is on grant writing. They are mostly, if they're not really on sexual violence, and if they are on sexual violence, they are more like they are taken, they are published, life continues like this. So we need to look at really what action can be taken, as has been said here, for the perpetrators. What action can be taken to ensure that the perpetrators are put into place? So there's a lot. That's why I said we need to work with stakeholders, we need to work with partners and collaborators to ensure that the perpetrators are really put into books so that they just don't go like this. But also on the side of the universities, as that I saw the comment, the chat, the side of the universities also need to relook at themselves. What are our roles in the universities in terms of victim support? Yeah, what Professor Arvind said, that are we really supporting them in terms of mental health, in terms of their taking their cases up? We need to look at ways and means of just not only doing researches, but putting this research into practice, moving from theory to practice. That is my biggest contribution. Thank you.
Thank you very much, Dr. Annie, in pointing that out. And I believe we don't have any further questions in the chat box. And I believe all the speakers in this particular session have also answered their respective question in the chat box. And that is very thoughtful of each and every speaker. So I'll just request Professor Beulah, if she can just conclude the session, and we can then proceed with the next session in a few minutes. Over to you, Professor Beulah.
Thank you very much, Vipin. And yes, I guess we are through this, and all these topics. It was a varied list of topics, even though the common theme was COVID here. So it was well handled and well appreciated as well by the participants, I see from their questions and their comments. So I would like to thank my co-speakers, Professor Tiwari, Ms. Garima Jain, and Dr. Annie. And thank you very much for all your inputs. And I'm sure all the participants have benefited from that, and they will a lot of takeaways from this session. Thank you, one and all. Thank you.
Thank you very much, Professor Beulah, for moderating and also being chair of this particular session. So with this, we have done with the session 2 of day 1 of the International Conference of Victim Assistance. I'll request all the all the attendees to fill out the feedback form, which I've shared in the chat section. And it would be really helpful for each one of us also, because we would have feedback for each and every speakers and we'll share with them. And it would also help us to make the upcoming edition on a better front. So thank you, everyone. And I thank again all the speakers and also the chair for taking care of the time limit and also adhering to that in terms of the session 2. We'll start with session 3 in 5 minutes. We are waiting for a couple of speakers. We have 2 speakers with us. We are waiting for the chair to join in, and we'll start as per the time as we have mentioned. I'll share the link again, and you can just take your time to fill out the feedback form. And in a couple of days, we'll share your feedback with also the speakers, which would be helpful for them also. Thank you very much, everyone. I will request all of you to stay.
Vipin, we can't hear you.
I'll share the feedback form again in the chat section. Thank you very much, everyone. Please stay online. So I've shared the chat in the chat, the feedback form. I'll request all of you to fill it up.
Okay.
And utilize this feedback form.
All right.
I'll request all the participants to fill the feedback form. Please utilize this time. We'll start sharp at 1:45. We may start a little early, so I'll request all of you to fill out the form. We have been joined by three speakers of session 3. We have Professor Edzange. We have two abstract presenters, which is Jose Benjamin and Miss Sarah Simmons. So we are waiting for Professor George Richards to join in. We'll just wait for a couple of more minutes for him to join, and then we'll proceed with the session. The session would be moderated by Akshaya. So I will just hand it over to Akshaya in a while. So let's by then wait for Professor George Richards to join in.
Can anybody hear me now?
Yes, Professor. Professor
Okay,
Edzange, we can
very
hear
good.
you. Yeah.
Is
So
it Beulah there?
yes, Professor Beulah is here.
Okay.
Beulah ma'am, you're on mute.
What?
Good evening, good afternoon, whatever time it is. How are you? Good to see you.
Beulah, how are you?
Good, keeping good. Thank you.
Good.
How's the family?
We are doing very well. They think I'm crazy to be here at 3 o'clock in the morning.
Thank you for doing that for us.
But this is really good. Oh, I see some familiar faces here. I see Sarah there. I see Mark. I see Palit.
Dr. Palit, you are on mute.
Hello, Professor Ansange. How are you?
Very good. How are you doing?
Doing good. So
Good,
it's
good to
actually
see you
early.
again.
Thank you. So
Yeah.
it's early morning for you.
Yes, it's 3 o'clock in the morning. It's crazy time. Yeah.
Thank you for being here today.
Hi, Dick. How are you?
Good. Sarah, how are you doing?
I'm sleepy, man. I was up at 4 a.m. for the opening. Huh?
Are you stay in Ireland?
Wales, in Cardiff.
Oh, Wales. Yeah, you are still in Wales. Okay.
Yeah, so we turned our clocks back over the weekend. So I had to check to make sure I get Indian Standard Time correct.
Okay.
Make sure you vote, okay?
Yeah. I did a lot of juggling to make sure that I am here at the right time too. I drew a map, tried to see. I find it easy when I have an American time and I want to know, oh, what time is it in India now? But now I have the Indian time and I'm trying to figure out what time would that be here. So it was tricky.
It will be more tricky for you because you turn your clocks this weekend, don't you?
What?
You're going to turn your clocks back next weekend, aren't you?
Yes.
Yeah, so it's good they had the conference this week. Otherwise, you'd have come in an hour late.
Yeah, it would have been 4 o'clock in the morning, would have been crazy.
I did. I managed somehow.
Yeah.
Yeah. Hello, Mark.
Yes.
Hi, Mark. Stay Mark up there too.
Dick,
And
welcome to my world.
Michael is there too.
Hey, and Michael.
Yeah.
I'm waking up.
I am.
Very
And I'm
good.
enjoying the fact that even though I live on the bottom side of the world, for the first time in 4 months, I'm actually speaking while the sun is still up instead of 3 a.m. or 4 a.m. in the morning. Because with the exception of the recent experience, I already had one teleconference early this morning, and I've technically got another one after I finish here early in the morning. But I think I'll be asleep, especially if I drink some more red wine with my dinner.
So thank you very much, everyone, for joining in. We have 3 speakers now. If Professor George Richards would be joining in, we will have him at the end of the session. But we'll follow the order as mentioned in the program brochure. So firstly, I would like to congratulate all of you to join in. As you mentioned that you're joining in early morning or even midnight, that you have taken time for this particular conference. And that is what makes this conference a success, having people from across the globe and from different time zones, making it a successful event. So I would like to introduce the session 3 and the last session for the day. And the session 3 is about oppression, injustice, and empowerment in times of COVID-19. We have 4 speakers. Currently, we have 3 on board. Professor Dick Adzange would be chairing the session, and he will be addressing first on victim of police abuse of power, a community response. We hopefully would have Professor George Richards talking about mental health self-care for first respondent. Then we have 2 paper presentation. Well, the first one would be by Ms. Sarah Angelina Simmons. She will be talking about analysis of maritime privacy in East Africa. And then lastly, we'll have Mr. T. Jose Benjamin. He'll be talking about impact of COVID-19 on mental health of police personnel in Chennai. The session would be moderated by Akshaya, and she will take care of the time adherence. And I will also request personally to each and every speakers to adhere to time so that we'll have a larger time frame for question answer round. So I will hand it over to Akshaya to introduce the speaker and then subsequently take over to other speakers.
Thank you, Vipin. Yeah, thank you, Vipin. So as he is already introduced, the chair for the session is Professor Dr. Dick Adzange. So he is currently working as a professor in criminal justice and victimology and serves as the director of Justice Research Center at St. Cloud State University in the United States. He is also a former member of the executive committee and chair of the scientific committee of the World Society of Victimology. He was also one of the founding members of the American Society of Victimology. He has worked in various areas in victimology, including domestic violence, substantive scientific victimology, victims of terrorism and abuse of power, and restorative justice. So today he would be speaking on victims of police abuse of power, a community response. So Professor Anzenge, over to you.
Thank you very much.
Vipin, could you please share the slides? Thank you.
Yeah, that's what I was going to ask you. I have a PowerPoint. Is he able to put it up for me? I can share the screen. Okay, very good.
Yeah.
If you live anywhere in the world today, you probably have heard or seen police demonstrations. The public demonstrating from against police for abuse of power. Some of these started in my home state of Minnesota. On May 25th, police were called to a grocery store because somebody had given a check, a $20 bill that they thought was a counterfeit. And somehow it ended in Lloyd being killed. And that has triggered quite a bit of demonstration worldwide. I want to say a few things, not talk too much, but I'll make this paper available for anybody who wants to see. Much of policing today, particularly in the English-speaking world, is credited to the work of Robert Peel, who served twice as a Home Secretary for the United Kingdom, Great Britain, and was Prime Minister twice also. In 1829, he established what today is called the Metropolitan Police of London, which has become a model for policing, especially in the British Commonwealth in North America and other English-speaking countries. I like to start from this and end with it, because what Peel did was to present what has become the core ideas of policing. And the goal of policing is crime prevention and not catching criminals. The key to preventing crimes is earning public support. And public support is earned by respecting community principles. In other words, police behave with decency and the principles that are shared by the community in which they function. And Peel also presented what are called 9 principles of law enforcement. The mission to prevent and not to repress. And the police can only succeed if the public approves of their existence and actions. Police must secure willing cooperation. Police can only serve public favor when they are absolutely impartial. And so the fairness is important in police credibility, actually. Police should always maintain a relationship with the public that supports a historic tradition that the police are the public and public are the police. The idea that the police should reflect what is the best about the society. And the test of police effectiveness is the less crime. And so, in fact, I do some consulting with the police, and there was a point where there was an invitation for me to suggest, how do we evaluate the police? And many people thought of, oh, how do you determine what is a good police officer and what is not a good police officer, and those kind of things. Can somebody move me forward, or do I do that myself? Okay, very good. And so from those principles over the years, there has been a funny change globally about exactly what do police do. And the theories and the attitudes for police departments have been focusing. Some police departments prefer to be seen as just service units. Sometimes are called public safety, sometimes are called, see themselves as conflict management, law enforcement, peacekeeping. Any one of these names or these designations represents a nuanced thinking about the department, about what the police are really supposed to do. I have worked with the police department in my city here for the past 25 years. During these years, they have had 3 different police officers, police chiefs. The first one, when I came here, did not want his department to be called law enforcement. He wanted his department to be called peace officers, because to him, their purpose was to keep peace, to maintain peace. They were not enforcing anything. They were encouraging the community to be as good as it has always been. And he did that until he retired. A new chief came, and the concept of law enforcement was his own thing. And therefore, enforcing the law was very important to him. And the attitude immediately changed in the department. That was served for about 10 years and then retired. And we had a new one. And this new one emphasis on the concept of public safety. He came from a sheriff department, and so the idea of enforcement is really not his own thing. Safety is his concern, not so much peace like the first one was, but this one general public safety and so on. And so every time these things change, they have some implications on the culture within the departments. And these meanings have significant implications. They mean a different thing to the public. They mean a different thing to governments. They mean a different thing to departments themselves as organizations, and to police officers who are employed in these units. And so an officer who is going out there to keep peace thinks differently from an officer who is going to enforce, an officer who is going to provide service has a different mindset and attitudes and so on. And so the kind of thinking about the police from the public, from the police themselves, shape the character of the police and what they do when they get out there. These meanings also have limitations and sometimes complications, because if we think of an enforcement, we want to arm or equip them to be able to force. If we want them to serve, then it's not too much important how much we invest in their equipment and so on. And so there are those implications. Next, somebody can move me. I want to rise to finish this. And so whatever the police do, we equip the police with 3 major tools. First, we give them authority, and we give them power, and we give them discretion. What are these 3 things? Authority is the entitlement to make decisions, or to act on our behalf, on the behalf of the society, as organizations and the community in general. Power is the ability to compare compliance with demand, orders, and expectations. French and Raven identifies 5 different types of power that can be used, that are often used in organizations, and some of those are used in police departments too. Coercive power, the ability to use force in order to compel people to do things. Reward power, that is where people get rewarded for doing certain things and or privileges denied if their things are not done. Expertise, where people are believed to know things and therefore their expertise becomes a qualification and entitlement. A referent power, the individual influence that people may have, and a sense of legitimacy that is associated with the positions. Discretion is the right to act without consultation. In other words, we give the police the authority they represent us, and then we equip them with power to be able to do what they need to do, and then we give them the discretion to use the judgment themselves to do those things. All of this become very important, very powerful, but are easily abused. Next, please, somebody. Okay. And so what are the causes and patterns of police abuse of power? Quite often, abuse of power is associated with corruption in society or corruption within the force itself. And many times this is because there are poor standards or lack of standards. There's a sense of a lack of accountability, greed, favoritism. These factors contribute in creating corruption within the police, or if they exist in society, might impact on the police themselves. Poor training and less equipment. I have been looking at policing in the US and in Nigeria, and some of these play differently here than it does over there. Administrative and management failings. The US is a very interesting country when it comes to policing compared to the rest of the world. It is the one country that does not have a national police. And so because it does not have a national police, the central or the federal government really has very little control over policing. And individuals, even states, do not own police. Cities do. And so every city that owns a police has a standard and its own culture and its own temperament. And the police cannot reflect those. And so if a community is racist, the police will be racist. If the community is progressive, the police will generally be progressive. And so the characteristics of that community shape the police. And then since the community controls it in terms of creating and keeping the police together, they really develop those standards too. And because it is a small, there are small departments, there are more than 42,000 police departments in the US. Some of them have only 2 or 3 police officers. That means that there is no opportunity for promotion, for evaluation, for change of pace or activities. If you are a police officer, you may be locked in that position for all the years that you serve. And therefore the structure that can create a boredom, can create frustration, can create over familiarity or any kind of things. Particularly, they reflect some of the failings in the society. And then of course, the challenges of the job itself. For the 20+ years that I have lived in this community, a lot of things have happened that have been challenging to the local people. One of them has been different, there have been different patterns of immigrants, new immigrants coming into the community. They have different challenges, different needs, and the police find it difficult relating to them. First, it was the Chinese, the Hmong people from China, from Asia, and then there were people from East Africa, and then people from West Africa, and now, and then of recent we had the Somali, Somali population. Each one of these new immigrants creates a different challenge or cause anxiety to the locals and also to the police. And so the challenge of the job continues to change. Next, please. And in the US, in many other countries, people get killed every day. We don't have data. The US data is not even not the best either. But let's look at just a small example. In the US, people die in the hands of the police by gunpowder that's being shot by the police, tasers, car accidents usually from high-speed chases. Sometimes people die in custody. Floyd in Minneapolis that started whose killing resulted in all these demonstrations was not shot. He simply had an officer press his knee on his neck and he died. And so negligence or recklessness of some type. But the number of police shot and killed, number of people shot and killed by the police has steadily been going up. There is an organization in the US called Killed by the Police. It's an organization that tracks down police brutality statistics. In 2020, this year, as of a few days ago, 804 people have been shot, not killed, shot. Much more than 1,000 have been killed, but 804 shot with guns. Last year, 1,004. The year before, 992. The year before, 986. The year before, 962. The year before, 994. And so there have been significant increases in killings. Now, if you add those who have been killed by other means than shooting, every year there has been more than 1,000 people killed. Next, please. And so, who are the victims of police brutality? And so on. Typically, the police, just like the rest of society, victimize the more vulnerable people. And so typically the poor, typically the ethnic minorities, typically the religious and cultural minorities, typically political opponents, typically suspects, motorists, people who are traveling and who are subject to public regulatory agencies, the people who are homeless, the mentally ill, the immigrants. Typically, the vulnerable populations become vulnerable to the police also. Next. And so in the US, as I said before, there's no national police. And so when we look at the national and international context and reactions to police brutality, in the US, there's no national police. Therefore, there's limited responsibility or role that the national or federal government can do. States and municipalities have responsibilities and face demands on trying to change the police. Demonstrations and riots have taken place locally, nationally, and internationally. Civil lawsuits, criminal prosecution options, education, and challenge. These are some of the issues associated with this police brutality in the US. I have a big book here that the state of Minnesota has put together to direct teachers how to train police, calling attention to certain things that need to be done. In Nigeria, there have been significant demonstrations in recent years, recent months. In fact, it's ongoing. Amnesty International has called attention to police brutality and abuse in various other countries. And so this is something that I'm sure you are looking at in India, and the various other countries where you live too. Next. And so, my opinion is the current emphasis on reforming police by targeting specific practices of the police will not work. Bad practices or habits can always be replaced by new ones. And so when the government says no chokeholds to US police officers, that sounds good. But the police officer may not use chokeholds, but may use something else. And so focusing on don't do this again is not necessarily the best way to help. Targeting particular practices by police to be prohibited will only lead to new ones being attempted or introduced. Agitations to defund the police as adopted by the Minneapolis City Council is also silly and doesn't work. The city council voted to defund the police, and then they realized, well, but we need to have the police. And so if we defund them, what do? Criminal convictions and financial settlements are no solutions either. Just as the country was demonstrating the killing of Floyd in Minneapolis, the city of Louisville paid $12 million to the family of Twana Taylor. Again, paying money does not help, and in many ways it bankrupts cities. And so it's not a helpful way, and those cities need the police. The best way to reform police and policing is to return to Pillian principles. And I want to talk about refer to those principles. I started with them, so I won't say much about them. Next, please. Okay. Remember the 3 core ideas. Reorient police towards crime prevention away from chasing bad guys. Mandatory arrest expectation sets the police towards escalation, limiting partnership. An officer who helps solve a problem rather than arrest is admired and respected. The push to make the police hostile to suspects increases the likelihood of victimization. I said this at the beginning, so I don't want to say much on them, except I want to call attention to Evelyn Wheeler's book published last year on smart crime violence prevention. He makes a very powerful case on smart policing that focuses on prevention and not waiting to respond to crime after it occurs. A very good example he uses comparing cities. Chicago has more than 2-3 times the number of police officers compared to I forgot what city in Canada he compared it with, but they have less crime over there than they have in Chicago. So having more officers, having officers more armed powerfully does not necessarily make the department, the community safe. So I want to conclude with the following. Go to the next thing, please. The next slide, okay. Recent developments globally have shown that many countries, the role of the police and the communities they serve has become contentious. In many countries, hundreds of thousands of people are killed every year. Besides those who are killed, many more routinely beaten and abused in different ways. Though police behavior like that of the citizens of every country reflect the prevailing behaviors and attitudes in that country, the killing of George in Minnesota led to a national, international focus on, I call it a global crescendo of outrage against police brutality. And so we have to pay attention to this, people who are victims of police. Sadly, much attention has focused on police departments and not so much on countries or cultures that create these environments. And so my real recommendation and conclusion is that my medical background reminds me of the Hippocratic Oath of doing no harm, which guides the practice of medicine. Like that oath, Robert Peel's core ideas or principles are as valid today as they were in 1829. Making the community the police and the police the community by preventing crime and not so much responding to it. Hi, George.
Hello.
Yeah.
Thank you.
That's
Professor.
all I have to say. I'm sorry, I don't know how much time I took, but I apologize if I went beyond time.
No, absolutely not, Professor. Thank you so much for addressing the issue of police abuse of power and how Robert Peel's ideas can, still be applied in today's time. So thank you so much for sharing that. We'll take the questions towards the end of the session, and we'll now move on to the second speaker for the day. So Professor George Richards have joined us today. Thank you, sir. So Professor Richards is the Associate Professor for Criminal Justice, Anthropology and Forensic Science Department in Edinburgh University in the United States. So his research primarily focuses on crime prevention in schools and the effects of mental illness of first responders. He has published in several peer-reviewed and popular publications, among these being Policing, an International Journal of Police Strategies and Management, the Journal of Contemporary Criminal Justice, and the American School Board Journal. Today, he'll be talking about mental health self-care for first responder. Over to you, Professor Richards.
Thank you and good morning. I would like to take this opportunity to thank the administration, faculty, and staff at OP Jindal University for once again allowing me the time to share with you my thoughts regarding what I believe to be an important and often overlooked issue regarding first responders in general and police specifically: mental health self-care. My presentation this morning has two parts. The first will address those stressors endemic to organizations that deal with crisis situations, specifically the police. The second will be a discussion of how these stressors affect those who work within these organizations. Obviously, my perspective is that of an American. This presentation concerns mental health issues with first responders for the most part in the US. However, the issues I will discuss represent challenges faced by police, fire, and emergency services globally. The bulk of the discussion will focus on policing and as it has generated the most literature and research. When it comes to stressors and when I discuss policing with my classes, I always mention the negatively charged aspects of service. Consider, when people call the police, do they want them there or do they need them there? The difference is important. The citizen may be grateful when the police arrive, but are even more grateful when the crisis is resolved and they leave. For physicians, counselors, and those others concerned with the well-being of first responders, it's essential to identify what kind of stressors are police going through and having to deal with when attempting to implement strategies relating to self-care. Self-care strategies are those intentional actions and attitudes we employ to take care of our health holistically. Some work, some do not for everyone, but you try and use best practices to see what might work when it comes to mental health self-care. It is highly dependent upon the individual. What is necessary is to act. The public and even mental health providers are often quick to assume that being a law enforcement officer involves constant traumatic and life-threatening situations, which can create long-term mental health concerns. Although it is true that many officers routinely deal with critical incidents and these have adverse effects on mental health from these events, these are only one kind of stressor officers face. Yet we start our section on stressors with discussing critical events. Critical incidents are the primary kind of stressor many identify as having the most impact. Roughly 1/3 of male officers have drawn their weapon in the line of duty, compared to 11% of female officers. Yet they may be required to attend to crisis situations by using their weapon, and it was, as one officer stated it, a constant damnation because of the vigilance they must maintain for themselves and others. Now, this vigilance is often maintained through periods of boredom. Most officers will readily admit their jobs are not as dramatic as some might think. Their days are filled with paperwork, court appearances, and routine patrol. This is supported by both the Toke and Hickman studies from 2002 and 2000, respectively. Among those critical incidents officers respond to or expected to respond to are accidents, homicides, shootings, domestic violence, child abuse, endangerment, and suicide, and these are just a few. But these are the most obvious stressors. Others are more subtle. Organizational stressors. Officers may feel the administrators and their departments are incompetent or enforce values not congruent with theirs. Officers may desire more freedom, more recognition for their work, better pay, or improved communication from their supervisors. Further, they may feel unsupported or misunderstood by their supervisors because administrators do not understand the current climate of the work on the streets, meaning of fearing punishment for small mistakes or infractions. Shift work. Law enforcement is a 24/7 occupation. As such, police seldom keep routine hours. Changes in shifts, overtime requirements, and lack of days off are commonplace. These unexpected but expected changes in schedule can play havoc on personal and family life. Relationship stressors. Variation in working hours and pressures of other conditions on and off the job can cause distress for officers and their families. All officers I have known have bemoaned the many events they have missed with families, birthdays, ball games, etc. The stress on partners in the relationships also may have an impact on them by having them assume a greater role in family life. And officers may be quite reluctant to discuss their days due to not wanting to traumatize their families. Under scrutiny and not stressor, given recent events, especially the treatment of minorities by police, is the ongoing scrutiny of the public as the entire profession is being held accountable for the actions of a few. Reason for body cameras is to record the event. While these often do protect the officers, it is often seen as another example of mistrust towards them. Officers are made out to look suspicious and uncaring after a critical incident, where they themselves could have also been considered victims. Overall, American officers have not done a good job of realizing they're constantly being watched by the public. Smartphones with video capability have ended more than a few police careers. And there's no better example of that than this summer in Minneapolis with the George Floyd case. Stressors for female and minority officers. Additional stressors may be placed on minorities within law enforcement, including female officers and racial minorities. Females comprise about 12% of officers in all local law enforcement agencies and 9.5% of supervisory positions. Female officers tend to experience more stress than their male counterparts, facing concerns such as having more negative perceptions of their work from family and friends, biases about their abilities, lack of role models, and harassment. Female police officers have also reported they feel more pressure to prove themselves to superior officers and fellow supervisors and fellow officers. About 27% of female officers in general belong to a racial or ethnic minority. Minority officers have the added stressors, in this particular discrimination from coworkers and civilians. Further, officers who are racial minority may face disapproval from family and friends as though they have to work much harder to gain their approval. And you have the normal life stressors. Just because someone wears a badge doesn't mean they are immune from the stress everyone else has to contend with. Like the rest of us, they may have sick parents, a child acting out, financial problems, a physical illness, or a marriage or relationship in trouble. With stress outcomes, officers are generally a resilient population, but certainly not immune from occupational and personal stressors. However, officers may still experience emotional and psychological distress specific to their occupation. Post-traumatic stress disorder, PTSD, it's what's called shell shock or battle fatigue. A person can develop this after they have witnessed or gone through a traumatic or terrifying event in which serious physical harm occurred or was threatened. It's a lasting consequence that can cause intense fear, helplessness, or horror, such as the unexpected death of a loved one, an accident, war, or natural disaster. Families of victims can also develop PTSD. Be very careful here. There are two common assumptions regarding PTSD, and both are wrong. The first is that the effects are immediate. No, it may take months or years for the symptoms to exhibit themselves. The second is having PTSD requires long-term and sustained exposure to horrific or dangerous situations, and the trigger for PTSD can happen instantly. So you don't need long-term exposure to develop a cognitive situation that will enable PTSD. Officers are trained to command their surroundings and the people within it. A critical incident can shake an officer's sense of safety and control. Research suggests that between 7 to 19% of officers may meet criteria for the disorder, with female officers being more affected by PTSD than male officers. Studies also indicate that up to 34% of officers may not meet the full criteria, but have PTSD symptoms that cause impairment. Beyond typical symptoms of PTSD, such as nightmares, hypervigilance, irritability, or flashbacks, officers may specifically experience guilt and shame. This shame may arise when officers feel they were unable to save a life or help a victim of abuse. We go from PTSD to burnout, with long-term occupational stress and trauma can also lead to burnout. Symptoms of burnout include poor work performance, misconduct, emotional exhaustion, disengagement, cynicism, and anger. This may also transfer into home life. In addition, officers may be emotionally distant and detached when working with citizens, or irritable, or suspicious of family and friends. Next is going to be alcoholism. Another outcome of police stress is excessive alcohol use. It has always been a part of the police subculture in the United States, and therefore, even though we expect it to be start out as a way of being integrated in the group, it can lead to a form of avoidance, another negative coping styles. Further, alcohol use is not illegal. With domestic violence, the actual rate of officer-involved domestic violence is not empirically known. We really don't know and have no idea. It's one of those things that when I tell my classes and talk to them about research methodology, there are things we know and things we suspect. And this is one of those things that we suspect. Estimates I've seen range between 1% to 40%. So with estimates in a range like that, we don't have any idea. But we suspect they're quite higher than we would like to think they are. Potential influences on domestic violence could be what we had talked about before: PTSD, shift work, burnout, alcohol use, plus the issue of officers being trained to work with an authoritarian and suspicious attitude, which can cause relationship strains when this approach is not kept at work. Then we go to depression and anxiety. The terms depression and anxiety are often used synonymously. The two may indeed work in tandem. However, this is not always the case. A person experiencing anxiety over an extended period may become depressed. Both disorders may lead to irritability, lack of sleep, and tension. Each of these cannot help but impact a person's behavior at home and in the workplace. In layman's terms, anxiety can be described as having a constant feeling of worry to the point of mental shutdown. Panic attacks are frequently found in the anxious. Depression, though, is different. Those who know little about it may define it as being sad. Don't make that mistake. They may appear sad and certainly feel that way, but it is beyond sad. For those with dysthymia, they experience a constant and consistent low-level depressed state with varying degrees of severe episodes. Depending on an officer's ability to cope with stress, depression and anxiety may become a part of life. Others may experience symptoms of helplessness, low self-worth, shame, betrayal, fear, and engage in behaviors like avoidance and repression, changes in eating and sleeping, and isolation. The last one I will talk about as far as how stressors can show up are suicide. It's one of those things, again, we are not quite sure historically how much of an issue suicide has been, but I'll talk about that at the end of this. An even more serious outcome of these reactions to stress is police suicide. Research has not yet yielded clear evidence as to where officers commit suicide more than the general population. Demographic variables are not always taken into account when comparing police suicide rates to the general population. And there's also considerable variation in the branches of law enforcement studied. However, there is a consensus among mental health professionals that law officers are far more likely to die by their own hands than by the hands of a criminal suspect. Contributing factors empirically associated with officer suicide include job loss or retirement, a sense of betrayal from other officers or administrators, feelings of failure, personal or familial concerns, past suicide attempts, alcohol abuse, and other symptoms of PTSD and depression. I personally believe, and from people I've talked to in the field and some historical sketches I've read, I think officer suicide has always been with us, and probably to the same extent it is currently is. It's just been, we are tracking it better now, and it is getting more attention. In conclusion, the totality of the problems and possible problems caused by a stress in an officer and a first responder psyche can be significant. However, we still know little about the extent of these pathologies. There could be a marked difference between what we know and what we suspect. If there's one thing that I believe could make a difference in our obtaining relevant data regarding stressors and their consequences, this is a change in how mental health concerns are viewed by the public service community. The stigma attached to these is still quite real. Officers being encouraged to be honest about mental health concerns will lead to more credible information on which to base informed practices. Thank you.
Thank you so much, Professor Richards, and thank you. I don't know what time is it over there, but thank you so much for joining us.
It's early. It's early.
All right, so we'll wait for the questions we'll take questions towards the end. So we'll move on to the next speaker. So we have Ms. Sarah Agnella Simons. So Ms. Simons is a member of the Executive Council of the World Society of Victimology, and she is the chairperson of All African Criminal Justice Society. As a self-motivated crime analyst and victimologist, she seeks to open up new frontiers for the discipline of victimology and professionalization of victims support in Africa. She has prior academic and administrative and research work experience with universities in Uganda, Kenya, Tanzania, Mexico, and United Kingdom. She has worked extensively on maritime piracy, and the title for her talk today is The Analysis of Maritime Piracy in East Africa, Impact on Seafarers' Risk Perception. Over to you, Ms. Sarah.
Thank you very much. And I want to thank the organizers of OP Jindal University for inviting me to be able to present this particular study. My study is based upon two sources of evidence. I get the evidence from a research work I did on an MPhil thesis by the entitlement of analysis of maritime piracy in East Africa between the years 2000 and 2010 and its impact on the seafarers' occupational risk perception. I did this while based at the Seafarers International Research Centre at Cardiff University in Wales in the UK. This study I did courtesy of a generous sponsorship by the Nippon Foundation of Japan, for whom I am grateful. While studying, I also had some work experience with the Witness Service in Wales as the administrator of the Witness Service, and also with the victim support section, providing emotional and practical support for victims of crime in the community. I'm also a member of the Executive Committee of World Society of Victimology, a role which has given me the opportunity to be able to observe some good practice in some countries. But I'll limit my presentation today to the impact on seafarers of maritime piracy, the bit that I observed during my study, as well as the recent developments with regards to COVID. During the study I did, my research methodology looked at problematized the maritime piracy, specifically in East Africa at that time, which was regarded as a global hotspot of piracy. At the fieldwork site, I gathered data at a Bristol port in the UK here, where I conducted interviews over a 6-month period in the year 2011. My research question, the main one that I'll focus on in this time given, was to gather a seafarer's perspective. So a lot of the data at that time had focused on, well, there wasn't much data, if you'd call reports of piracy data, because a lot of them was self-reporting, and there was in my thesis, I give a section to looking at the critically analyzing the self-reporting data on maritime piracy at that time. But there wasn't really much data that reflected seafarers' perspective. So seafarers were quantitative data. There were numbers captured. There were a number of people for whom ransom was paid. There were a number of people whose hostage period was reflected as a number that was increasing. But I was hard pressed to find any data that gave seafarers perspectives, and therefore I can relate to yesterday's presentation by Anamka at yesterday's conference, in which she said there wasn't really any database on maritime piracy at that time. For me, it was 2009 when I started conceptualizing this study. So my research question was, what were seafarers' views about maritime piracy? And this is very important for East Africa, because the piracy, mode of piracy that that I observed, that I was focusing on, was a kidnap for ransom piracy, which is different from the piracy that was happening in Malacca Strait before that, which is different from the mode of piracy that was motivated by the desire to seize contraband goods in Southern America in decades before, which was different from historical piracy, which was to seize maybe goods or minerals or high quality goods on ships in decades or centuries past. In East Africa, it was to kidnap the seafarers and get the ransom. Even if they hijacked seafarers on an oil tanker, the pirates of Somali coast were not interested in that. And sufficient background was presented yesterday. Well, I limited myself to a heterogeneous sample of 44 seafarers. I looked, I get the data on their personal data, because in this case, I wanted to look at the seafarers' lives, their ages, their marital status, their nationalities. And it's interesting at this point to note that the seafarer working force today is a multicultural and a multinational crew on board. It's no longer, very rarely, apart from some crew like Chinese, do you find single nationalities. They're multinationality. I looked at the work experiences, the ship type and the cargo, and my data collection instrument was a questionnaire which contained 2 very interesting vignettes. And that is very important to mention, because at the time I did this study, seafarers were being actively discouraged from speaking about piracy because piracy had reached a crisis level and seafarers were threatening to down their tools. Yet seafaring is the lifeblood of the globe economy. So they were being discouraged from speaking about piracy so as not to encourage others to be fearful. So embarking on this study, I then would like to focus on the seafarer occupational risk, because that is where you have precipitators of stress. Seafaring, from my study, I found that seafarers are faced constantly with a number of occupational hazards that co-occur. There's fatigue, there is, and this is what they listed. They face danger of vessels colliding, of bad weather, of fatigue because of the mechanization of labor. There are fewer crew of board working longer hours and with less rest, fire on board, and being abandoned abroad. And in addition to all that, there is piracy, and then now COVID. And each one of these stresses, they happen at, most of them happen at the same time. Seafarers spend a very long time at sea. They spend months at sea, and therefore they are faced with long periods exposed to these. In my data, I found that the seafarers ranked maritime piracy as the highest, the particular hazard that causes them greatest anxiety. They were actually preoccupied with the fear of pirate attack. Even seafarers who worked in other parts of the world where there were no piracy said that from the information overload about piracy they received, they tended to expect a pirate attack as an imminent threat, and that every vessel passing along high-risk areas was exposed and was at the risk of being attacked. They said all seafarers are potential victims because they had been told that by fellow seafarers that seafarers are attacked, and when they attack, all seafarers on the ship are at risk. So therefore, when you look at the occupational risk perception, as I perceived of it, as my study showed, the seafarer said every ship passing East Africa is a pirate target. Therefore, they referred, there was a geographic disparity to this fear. When they came in East Africa, because they did drills, there was target hardening. So there is, the ship is, there's barbed wire around the ship because they expect that the whole thing was to harden the ship as a target so that it wouldn't be boarded. So the ship actually became like a fort, fortified, it was barricaded. And because seafarers they don't have day off when they go off the ship. They sleep, live, eat, and work on this built environment. So the seafarers started having a sense that no seafarer was safe, whether you were on duty or off duty. They all knew on the ship where the citadel was, but the ship is a very big environment. So all crew were at risk. And they said, pirates are dangerous, they kill. And one thing they mentioned was that the hostage experience they'd had from some of their colleagues who had, come undone after the hostage experience also made them fear for themselves as well as the impact it would have on their families. So most of the seafarers who worked on ships, and ships, if I may mention, work in a global political economy, which means they go around different parts of the world through different jurisdictions. So therefore, at any one time, all seafarers pre-boarding, pre-departure briefings include a briefing on best management practice, which is what to do when seafarers, passing through high-risk areas. And high-risk area could be Malacca, could be Eastern Africa through the Suez Canal. And so therefore, seafarers mentioned that they had problems sleeping. They were hyper-vigilant, and that was considered to be a good practice, to be hyper-vigilant, to be observant. Some of them were self-medicating as a way of coping because they were worried and they were anxious. And some had been diagnosed with PTSD. Some who had experienced hostage experience were then after the medical insurance test, they were found to have PTSD. Some from a particular nationality were also found that their families developed PTSD while their loved ones were under pirate, in the hands of pirates. So when COVID started, it came at a time when seafarers were coping with piracy over a prolonged period of time. These are groups of Indian seafarers who had been taken hostage. These ones had been kept for 4 years in unknown places. They had survived attacks on their ship, but the ship had been boarded by pirates, and the pirates had taken them to land where they had been kept. And this one here is the longest serving hostages. They were a Thai crew, and they were kept for 5 years. During that time, we heard that there was the increased use of torture so as to quicken up the payment of ransom. it didn't always work that way. So the crew would be handed over to another group of pirates and to another and another. And so they went further inland, and then when was paid, there had to be a way of finding them and bringing them back. So when COVID started, now 4 main impacts added to the list of difficulties seafarers had to contend with, because ship sailings were canceled. Remember, COVID epicenter started in China, and China has 10 of the biggest ports in the world, serving the world. China is the industrial area of the world. A lot comes from there. So when ship sailings are canceled, guess who loses jobs? And then when COVID happens, seafarers are unable to leave their ships to go home. At the end of a contract, they need to disembark, they need to go home. They were not able to go home. They're stuck in hotels and for months away from their families. So in short, seafarers, as a result of piracy and COVID, they have a very fragile mental health, and they face multiple victimizations due to convergence of occupational hazards over a prolonged period of time. So therefore, seafarers face a number of challenges, and it's considered part of they're considered to be very stoic, but a lot of studies are coming out to show that their mental health is suffering and they are victimized. It's hoped that the Maritime Labor Convention 206 will be able to ameliorate against some of those. Finally, I'd just like to finish with this one slide, just informing participants of an event coming up, a training specifically for Asia by UN Office of Drugs and Crime to stakeholders for the implementation of a UN convention against transnational and organized crime. The deadline has been extended, and that is the link. For more information, I think Vipin has the information that he can convey to everyone. I thank you for this opportunity to give me the opportunity to be able to share just a tip of the iceberg of the findings of my study. Thank you very much.
Thank you, Ms. Sarah, for sharing your research on maritime privacy from a seafarer's perspective, and also for discussing about the mental health of the seafarers, which are, very rarely talked about. So thank you for that perspective. So we have our final speaker for the day, Mr. Jose Benjamin. So before introducing him, I would ask the audience to please put in questions for the speakers on the chat box. So we might have time for a few questions towards the end. So Mr. T. Jose Benjamin is the final speaker. He is a research scholar with the Department of Criminology, University of Madras in India. He will be speaking about the impact of COVID-19 pandemic on the mental health of police personnel in Chennai. So over to you, Mr. Benjamin. You're on mute. Yeah.
Thank you, Ms. Akshaya. And at the beginning, I would like to thank Jindal Global University and the Jindal Institute of Behavioral Sciences for having initiated such a wonderful conference and bringing together lots of eminent personalities such as Professor Dick and Professor Richards and several other eminent victimologists and criminologists around the world for this conference. And coming to my study title is The Impact of this Current COVID-19 Pandemic on the Mental Health of the Police Personnel. As already we have all known, policing is something considered to be always something stressful one. Policing is something which not only just deals with the impact of law enforcement. In India, policing also includes multiple other works that come up in addition to what they have actually been specified or actually been dedicated to do. There have been existing many literatures and studies considering the stress of policing, mental health issues faced by the policing, and the psychological well-being of policing and everything. What I wanted to do the study on was the current situation has majorly affected the so-called frontline workers of the society, called as which includes the medical personnel, there may be revenue department personnel, and also the police department personnel, because police department personnel have played a major role in controlling this pandemic situation, especially in India. So I wanted to do a major study in this because police personnel or someone who is not exactly trained to do or handle situations such as this, such pandemic situations. So coming to the study, I wanted to study how it had impacted their personal life as well as the lives of their families and etc. and their psychological well-being, this situation. So the samples for my study was, there were two categories of police personnel as we see. One is the higher administrative level, and the second is the lower level of police officers who work on the field and most of the time are involved. So considering the significance of the study, I thought I'll go with the lower level of the police, as they were more involved in the field and they were more prone to the significance of my or conclusion of my study. So going with it, I had a sample of around 120 police personnel who were equally split up between 6 ranks, from inspectors of police to sub-inspectors of police, special sub-inspectors of police, head constables, grade 1 constables, and grade 2 constables. These were the lower 6 hierarchies of police, and these were the personnel who were basically involved at the ground level, establishing all the control measures and protocols during this pandemic situations. So I wanted to do a study on how it had affected the psychological well-being of their wellness. And the first and foremost was that 90% of the personnel who were interviewed had felt that the workload of them had significantly increased after this pandemic situation. And they also had a thought that most of the works that they were doing during this pandemic situation were something they were not trained to do so, and also something they were not they felt that was not a part of their routine work or something, because policing is usually something related with law enforcement or control of crime and law and order and etc. But what they were doing during the pandemic situation was not exactly within the terms of law enforcement, etc. And one more thing was that its impact on its work-life relationship. That was the personal, that is a major personal contributor for the psychological well-being of the individual, for the police personnel. The work-life relationship was that the pandemic situation created a fear among around 65% of the police personnel that they might be a reason or a trigger to because of them, that their own personal or family members or friends and relatives may contract the virus or the pandemic disease, as they've had more chances of being exposed to the diseases. And this has significantly impacted them in many forms, such as around 45% of the police personnel who usually spend around 8 hours or around minimum of 8 hours a day with their family have now significantly reduced spending time with their family. Around 5% of the police personnel had completely stopped being with their family. They had started staying alone, and around 4 of the samples, they hadn't visited their family at all in the past 8 months. So this was something to be seriously concerned, because this not only affected their own psychological well-being, it also had an impact on the psychological well-being of the family, because they seemed more concerned about what was happening and what may happen to them. And one more thing which added to it was the death of their own colleagues. Some of them, some of the police personnel started contracting COVID-19, and it started creating a pandemic panic or anxiousness among the other personnel, which led to more and more impact on their existing psychological well-being issues. And one other thing was they felt that they did not have the proper situation or proper training or modules to what they basically, they themselves did not have much idea of what should be done or how the pandemic should be controlled. And one more thing was that they themselves did not have a very clear-cut idea of what the pandemic exactly was, because none of them have been clearly instructed, or none of them had been clearly trained of what situation that they are dealing with and what exactly their roles are to be, and so and so. And one another thing was the shortage of the faculty. In Tamil Nadu, in Chennai city, there are around 24% of the police personnel vacancies. In a place where 100% are supposed to work, there are only 76 of them working. So it has, additionally, there is an existing workload, and this pandemic situation has significantly contributed even more to the existing whatever they workload that they were having. And coming to the programs offered by the Greater Chennai Police or the government of Tamil Nadu, the government is also trying to make initiatives and measures to focus on the well-being of the police personnel. For example, they conduct monthly yoga camps and etc. And they also conduct other workshops where they impart the importance of psychological well-being and the importance of spending time with family to the police personnel. But when interviewed, most of the police personnel felt that all these programs implemented by the government or by their organizations were more or less of the namesake namesake programs, and they were not serving its actual purpose, as they were mostly being constructed in mass numbers, where thousands of personnel were brought together, and they were being given a session or given a lecture or given a demonstration of what to be done or what not to be done. What they had more felt was it should be an individualized and personalized care program where they should have an opinion of what they actually need and their problems should be addressed. That was the major suggestions given by most of the police personnel. And apart from that, they also had a feeling that this pandemic situation had led to a situation where they are not able to focus on their physical as well as mental health, because it has caused like a timeline where they are continuously on around the clock on the duties. Earlier, if they had been on an 8-hour shift or something, now they had been on a 12, 16 hours, sometimes even 24 hours. Some of the personnel at lower levels, such as grade 2 PCs, they had been working for 1 or 2 days continuously without even any break or any sort of thing. So all these factors are the major issues that that was the findings of my study. And what were the suggestions was that occasional physical training as well as psychological training programs should be organized. And the most important suggestion given by most of the police personnel was that there should be a defined workload, as none of them have any defined workload that this and this is the so-and-so actual work of them. So these were the actual findings of my study. And one of the major limitations of that was that since all the personnel I had interviewed were of the lower rank, most of them expressed fear. I had to approach around 200 of the police personnel, but I was able to collect my data only from the 120 of them, because the rest of the personnel were afraid that some action or some initiation may be taken against them, or they were reluctant that they might be affected because of actually telling out their grievances, and so and so. So these are the findings of my study, and this is my research. And I would like to thank you and thank Jindal for this opportunity.
Thank you so much, Mr. Benjamin. Do we have any questions for the speakers? All right. So, Professor Nzenge, would you like to give a few concluding remarks?
Yes, I will do that. Thank you very much, participants. And I have learned quite a bit from listening to each one of you, as you have raised some very interesting observations. A few years ago, I listened to Sarah, and it's good, Sarah, listening to you again and to be exposed to the welfare ideas and challenges, because that's something I don't always think about, because I've gone on cruises a few times, but that's a lifestyle that until it's on the table, I become familiar. I think about it again. There are many challenges that we take for granted because it's a life that other people live that we don't. And the same thing with Professor Richard's discussion on the mental state of our police department, police officers, the challenges that officers face when they get called to different situations. And many times we don't think about the trauma that people experience in these different positions. For me, from a victimologist perspective, many people think about the victims from a very particular dramatic things, but many times the insidious suffering of dealing with difficult situations is really a very important and in fact critical form of victimization. I was talking to somebody yesterday about the suffering of refugees. And many people think of the immediate refugees, and many times they forget that the children of refugees inherit some of the suffering that their parents went through, and it goes through many generations before people really get out of that. The same thing with the Benjamin's focus on the pandemic and the medical and mental implications of it. Again, is direct and indirect victimization that we are all cooped in this kind of situation, this trap that nobody knows when we are going to get out of it and how we get out of it. Every day you have conversations with academics and people in different professions. When people talk about recovery, what will it look like? And so this is a very informative session. Thank you, every one of you. And thank you, OP Jindal, for making this possible. For those of us who do a lot of traveling, who are not traveling, this is quite a good opportunity to reconnect with all of you. VP, thank you very much. We really do appreciate your coordination of this program and our activities. Palit, thank you very much. And thank you everybody for participating in the process and in the on the committee today. Appreciate it. Thank you. Bye-bye.
Thank you very much, Professor Zange. And I would also like to thank I would also like to thank each and every speaker, and we do agree that most of our speakers are joining in very odd hours, maybe early morning or midnight. So I would also like to thank Professor George Richards, Ms. Sarah, and also Jose Benjamin, who has joined. And I have also shared the feedback form, which is very crucial for each one of us because it helps us make better in each and every edition. So I'll request all of you to share your feedback for each and every speakers that we have today, and we'll share that with the respective speaker in the coming days. So I would like to conclude day one. And it has been very insightful and fruitful day one. We had all the speakers. There were close to around 12 to 15 speakers, including our inaugural session, where we had speakers across globe. And we also assume that we'll have way more enriching and fruitful session as day two, which will start a little early. So I'll respect all the participants to join in by 8:50 a.m. We'll have our plenary address at 9 tomorrow by Professor Erwin Wallace, and then we'll begin with session 4, and respectively we'll move forward. So thank you very much, everyone, and I wish good morning, thank you, and respective greetings for each one of you who have joined from respective time zone. Thank you very much, everyone.
Thank you very much.
Thank you.
Oh, Beulah is there. Beulah, thank you very much for coming and for being with us too.
Thank you, Beulah. Thank you, George. Thank you, Deep.
Bye-bye.
Bye-bye. Bye, Vipin.
Bye.
Yeah.
Thank you, panelists, and hi, George, and hi, Sarah as well.
Okay, bye-bye.
Hi, Manju.
Hey,
Okay.
good to see you guys.
Good to see you.
So I'll request all the participants who have filled the form, they can exit the meeting, and you will get the second day link by today evening. So please log in by 8:50 tomorrow, early morning, Indian Standard Time, and you will be able to view the speaker list and the list of speakers that we'll have for day 2 as per the program schedule. Thank you very much, everyone. Please fill in the feedback form and you can exit the meeting. Thank you very much.
What is the form?
Okay, I'll again share it. Yeah. I'll again share the feedback form in the chat box so everyone can see it.
Oh, it's in the chat box. Okay, thank you very much.
Thank you very much.
Sit there for some time.
So I can exit now, right?
Yes, sir.
Okay.
Okay. Goodbye. It was a pleasure.
Bye.
Yeah. Thank you, sir. Thank you, Professor.
Bye, George.
Sarah, contact me.
I will. I'm just trying to save it. Vipin, could you keep it a bit?
I will forward it to you separately.
George, what did you say?
I want to
No, I
save.
was talking to Sarah.
Oh, okay.
I want to save the chat. Oops.
Thank you very much, everyone.
How long are you keeping the form on, Vipin?
The form would be there for 30 more minutes, so you can fill it.
Because I want to do for all sessions now.
Yeah,
can
so
you
you
extend
can.
it beyond 30 minutes? Because I'm part-sighted, so I go a bit slow.
Sure, not an issue. We'll keep it for an hour more. So hope you have all the links and you can fill it up.
Yeah, thank you. Yeah, just a sec.
Yeah. For anybody who's facing an issue, they can directly mail me. We'll be able to help every individual. So if you have filled in the form, then we'll request you to exit the meeting. Thank you very much for being part of day one of the 9th International Conference on Victim Assistance. Thank you very much, everyone.
Thank you, Vipin.
Vipin, Neeraj Kumar has mentioned in the chat that he's not able to fill out for this session. He's filled in the past. I've sent him a message. I will just work around if by chance there's an issue.